What's the 411, everybody?
With Chris, Nick, and Rad.
It's good, hey?
Yeah.
Bring the mic a bit closer, Nick. Yeah, and Kev. What is that?
Well,
You guys are live, by the way.
I had a blocked nose this morning, so I saw Kevin having a whiff.
Oh, that smells nice, actually.
It is, yeah. Go, take it.
Oh, it really opens up your nasal passages.
Oh, my stepmom has this stuff.
Yeah, it's from Thailand. Wow. Oh, I'll bring you guys some next time.
Do you get it from the Thai guys next door?
No. Like I bought it in Thailand when I went
right.
to Phuket earlier this year.
How was your Phuket trip?
It was good. It was good. Hey, it was with my missus. So there was no shenanigans.
No.
That happened.
Why are you smiling?
No, because like whenever I've gone on the physio, I always talk to Kevin about recreational marijuana over in Thailand. So the things that we're not the things that we need to cut out of this.
No, Nick, can you introduce our guest today?
We have Kev La of...
What?
He's completely butchered your name.
Kev Lay. I mean, Kevin Wilson Lay. Kevin Wilson Lay, that's your full name?
It is, yes.
Kevin Wilson name of...
I don't even know your middle name. I'm surprised you even know his middle name. I've known Kevin way longer than you, Nick. I don't even know this about Kevin.
I just thought of the first Asian last name that came to mind and I said it. Apologies.
all
But
good.
of SportsLab physiotherapy fame. Yeah.
Please don't ever get him to do introductions ever again.
Yeah, no, Kevin is the physio for most of the boys that train here. Would you agree?
I think so, yes.
Yeah, and you do obviously other gyms and other sports. Would you say you're the head physio of SportsLab Alexandria?
I would say I'm the face of SportsLab.
Yeah,
You're
like
the face?
No.
I'd say he's the most.
sorry.
He's the physio you see the most with Maddie.
Yeah.
Well, Tom doesn't really work anymore, so
Tom doesn't
shout
work
out
anymore,
Tom.
so, you know,
Tom is the owner
privilege
of
of being a
SportsLab.
director, you just pretend like you do work.
So,
Jokes.
the reason we bring you on is because you are obviously a physio that specializes in combat sports.
Yeah.
Would you say that's your field of expertise?
You're a blue belt yourself
Yeah.
Yes.
Also a blue belt in Brazilian
with
Jiu-Jitsu.
some striking experience.
Yeah, trained a bit of Muay Thai as well, but blue belt under Mr.
Chris
Chris over
Collins.
here.
Oh, cool.
From Gracie.
Yeah.
Back in the Gracie
Back in
Muay
the
Thai
Gracie
days.
days.
Strong lineage there. Strong lineage.
Yep. And what was I going
Look
to say?
like you're stuck there, mate.
Yeah. and-
So
go on.
when did you start as a physio treating primarily jiu-jitsu athletes?
Great question.
That's a good question. I think when I finished uni, I worked at a few different places actually. I worked at like a Pilates place actually, first off. So
Where
like
was it?
it was out west though.
Okay.
And this is when I was training at Alex Pratis's gym.
Yes,
Spinning Grange.
Because so do you treat Robert Whitaker and all
No.
those guys?
Oh, I treat like Izzy
And
and I've
Jacob?
treated Jacob.
Yeah. Okay. We'll get back to that.
Tierney
Sorry.
and
Keep
Brad
going
and
with your
those
story.
guys. And then that's when I was working with them. But I was just mainly doing that kind of like volunteer wise. Like I wasn't really treating too many of them at the clinic.
So you weren't getting paid?
No. This was all like, I think to make ground in this kind of field, you have to do a lot of like, but this is the same with soccer, you know,
Yeah.
when you were.
Or jiu-jitsu.
Yeah, jiu-jitsu,
Yeah.
footy and stuff. You do a lot of like volunteer-based stuff.
Yeah.
Just to get experience.
And so why did you choose martial arts like combat sports?
Well, because I'm Asian, so it's part of my genetic.
Yeah, you invented it
I did invent it, yeah.
when you think about it.
Yeah.
Yeah. So why jiu-jitsu? Why did you do jiu-jitsu specifically and Muay Thai?
So friend of the gym.
Yeah.
If you guys remember Shannon Connor.
Oh, yeah.
So yeah, we went to school together. So get this right. We went to school together, and I think it was in year 12. Like we were both really into watching the UFC.
Yeah.
And then we were like, oh fuck it, one day let's just go and try out like jiu-jitsu. And then Gracie back in the day was in Coogee.
Yep. I've been to Coogee.
Was it
Yeah.
or was it the Bronte one?
No.
No. This
So
was in-
Coogee is where Bruno originally was located.
Yeah.
So that was after the Maroubra Surf Club.
Oh,
So
okay.
I think that was his first like big established jiu-jitsu academy.
Coogee was the first real Gracie Minor gym in Australia, right? Like the first proper
I don't know.
I think that was where Bruno first established his gym.
You look this up.
Because I think he was teaching outside in Maroubra Surf Club.
Right.
And then I think
Then
essentially
he-
that's where he established his first business. From what I can remember, I remember going and doing a Hoyler Gracie seminar there when I was white belt.
Yeah,
a
yeah.
long time ago.
So this was like 2009.
Yeah.
And then,
Shannon started at Coogee.
yeah, he did. Yeah.
Did you do a class at
Well,
Coogee?
let me finish.
Yeah, yeah.
So we went there. We did a trial. Bruno was there.
Yeah.
And then the funny thing, I'll never forget this. During the warm-ups, like, you know when you do your forward rolls?
Yeah, yeah.
Shannon corked his hamstring doing a forward roll. He had to sit on the side for a little bit to stretch out his hammy after that. And then we kept going. But then anyway, at the end of the day, he signed up and he kept going, but I was too poor to
Oh,
continue.
you couldn't afford it. No,
I
Bruno
wasn't working.
had high prices back then.
Well, I wasn't working at the time. So
Remember how much it was? Mum couldn't buy it for you?
No, mum wasn't
Really?
paying for shit for me. It's probably like 30 maybe,
$30 a week?
or maybe 25 or something. Did he have student prices? I'm not too sure. Maybe
I
30.
didn't
You were really
originally
poor,
start
bro.
under Bruno. So
Yeah, I was.
Yeah, that's real poor.
Yeah.
that's crazy.
It was like, $30. And then Shannon kept going. And then I went to uni. Then I got a job at the gym at East Gardens, actually. And then I was about to join jiu-jitsu. And then a friend was actually doing Muay Thai at SRG.
Yep.
And so I tagged along. And then I actually started at SRG first, like formally.
Yeah, right. And then you went upstairs to Grace.
Did you do a combo account?
No, I was too poor for the combo. I could afford only the one at a time.
Yeah.
Yeah. So like, but then, so remember SRG used to be inside of Gracie's?
Oh, at the back room.
Yeah, at the
that's
back room.
right.
When you started there.
Yeah.
Oh, right.
So then I had to, we had to like, so I was still seeing Shannon there.
Yeah.
But then he would go off to do jits and then I would walk to the back room to do Muay Thai.
Right, because I remember when they split, SRG went downstairs and SportsLab originally was sharing a space
Yeah.
with SRG downstairs.
Yes, in that little like warm-up mat area.
Yeah, it's crazy how it's evolved.
Yeah.
Now I've heard you guys have moved the location down the road.
Have
Yeah.
you seen the new location?
I haven't been there
So
yet.
Sports Lab, everyone has a new location. What's the address?
530 Botany Road.
If you need a physio.
I just remember like speaking to you saying, sorry, I haven't come and seen you recently.
it's
you know,
okay.
like
It's actually sick, like the new
But
Yeah.
he was saying to me, he's like, it's good that you haven't come and seen me. It means things are going well. So
Yeah.
Hopefully, yeah.
hopefully, yeah.
It's actually sick though. Like it looks like kind of modern, like polished concrete floor. You've got a little mat area.
Yeah, so we actually got
You
a
training
little
that
mat
on
area.
that thing?
No.
There's a dummy with Kevin's face on it, and they'll take
Yeah.
this out of it. Yeah.
My old grappling dummy when I was a keen white belt.
Yeah.
Nice. Oh, you brought it into.
Yeah, I brought it in. I had to duct tape it up though because there were a lot of holes in it.
Yeah.
But
Odd. Why were there holes in it, Kevin?
from ripping arm bars. Hey, all the holes were like around here. Okay.
Even weirder.
Why is there a hole on the face?
What has worse injuries in your professional experience, Muay Thai or Jiu-Jitsu?
I'd say jiu-jitsu for sure.
And more frequent,
Yeah, more frequent too.
and like an extensive range of injuries.
Yeah,
Obviously, in Brazil.
bigger range of injuries.
Can I say something to that?
Yes.
When I came in with my ACL, I remember seeing majority, there was like 4 other people that were there with ACLs and they were all Muay Thai fighters.
So that is true. So, I'll put it to you this way. In my experience, the jiu-jitsu guys get injured more often.
Yeah.
And a whole range. So like from minor injuries
rib cartilage, serious stuff.
to major
Shoulders,
stuff possibly requiring surgeries and stuff. Whereas in Muay Thai, you'll get like little niggly things, like little ankle sprains, but they can still keep training. And you'll get like contusion-based injuries, like kicks to the ribs and the
Yeah,
shins.
yeah.
But then when they do get injured, usually, like sometimes it's fucking bad, like requiring
Because they get
3
into
ACLs.
clinches and stuff, they get turned over their legs. Is that when you would probably see more ACLs happening? Their feet are planted.
Yeah,
getting
that's
rotated?
one cause, but
Yeah.
more often it's like from kicks.
Really? They
Yeah.
do
To the
ACLs
knee?
from kicks.
Yeah, like
caving the knee.
No, throwing kicks. So you're the person throwing, and then like you might get your kick caught, and you might get dumped,
Right. That's the
yeah.
rotation. That's
Yeah, the
happening.
rotation. Yeah. So,
So
that
maybe
happened.
the trick is to just not throw kicks.
I think that's the trick. Yeah, it's the safest.
I think that's going to be hard to do that in that sport.
Yeah.
Yeah, but
It's interesting.
yeah, it is. That was just a weird time when you came, hey, because we had
So
like
weird.
literally 4 to 5 ACL.
And then I did mine not long after.
Yeah.
Yeah.
But I
2
remember
months
all the
after.
guys that I was in there with, all of them needed to get operations. They couldn't stand. They're all on crutches.
yeah.
And I was surprised that I was even able to function.
Yeah, you pulled up pretty well after yours.
Interesting.
Must be a mental thing.
They
Must be that jiu-jitsu
Yeah.
toughness
They
that the Muay
they
Thai
don't
guys
build
don't
them
have.
like they used to, mate.
And so, what is the worst injury then for jiu-jitsu practitioners that you've seen? Like, I guess what's obviously ACL has the longest rehab, or
Yeah.
one of the longest rehab with like hip dislocation.
Would shoulder reco be up there?
Yeah, definitely.
Yeah.
But what's like the worst one you see? Like, it's really hard for them to come back from.
Yeah, it's a good question. I think knees are probably up there. If we just break it down by body part, knees are up there.
Yeah.
Because, there's so much flexion, loaded flexion, stuff like that. Necks are pretty bad. too.
Yeah.
Yeah.
Like neck, yeah.
It's like hard to come back from.
I know
It's really-
two
yeah.
people with major neck injuries, Jason Guillardi and Owen G. Key, which was my original coach.
Yeah.
But they both had like really bad disc issues. in their
Yeah.
neck.
They're pretty hard to come back from.
And I'm pretty certain Owen had surgical procedure done on his neck.
How do what's the main way that necks get injured in jiu-jitsu? Is it getting
Stacking?
choked or is it stacks?
It's normally like
Stacks.
stacking and the wear and tear over time that comes with that, like the degenerative process of this.
Nick's like, ooh.
Nick's putting everyone in guillotines. like,
No, I don't care about that. I stack myself a lot.
Yeah, I know.
But then you get like that acute trauma as well. Like let's say if you like during a takedown sequence and the head hitting the mat.
well, there was a guy over in the States from, what was the one in Miami?
The Henna Gracie.
No. That was
Oh,
that was one
yeah,
incident.
the one that-
But there's an actual young athlete from what's Cyborg's gym called?
Fight sports.
Fight Sports. There was a young up and comer brown belt that got done on his neck from a fireman's or something like that.
Yeah.
And now
Again, the
he's,
fireman's.
but now he's literally in a wheelchair. It's the saddest. And he was a big prospect in jiu-jitsu.
was a
It's
sad
really
story.
sad. Like, really sad.
I've seen I haven't seen a bad neck injury like to the point where someone's paralyzed, but I've seen one that's put people out for a few weeks where it's often people like kind of turtled up and then someone's got like 2 hooks in and then the person on bottom rolls forward like they're being carried like a backpack and then the head hits the floor and they can't. You get what I'm saying? Like
Yeah,
they can't
no.
rotate through and then
Yeah, I remember there was some controversy with that, wasn't there? Because
Are we talking about
one of
that
the
young
Gracies-
kid that...
No, that happened.
Oh, we're
and there
talking
was a
about the guy...
lawsuit.
Yeah, the lawsuit.
you can get Hendo to look it up.
And
There was a lawsuit. Remember the lawsuit that they had Henna Gracie go on the stand?
Yeah.
And he
Yeah, I remember this.
he testified against the black belt, if I remember.
Yeah.
yes.
Yeah, and it kind of fucked jiu-jitsu because it set
Didn't
a
he get
precedent.
paid to do that too? Of
course,
He
and
got
and apparently
paid for his time.
Yeah, I don't know. We'll ask Hendo to look it up. How much? Who was it? Henna Gracie.
Yeah.
got
That's Henna
paid.
Gracie.
There was an hourly rate that he got paid.
it was
and it was
exorbitant.
something ridiculous.
I think he made.
some egregious
hundreds of
amount.
thousands
Yeah, it was like $50,000 an hour.
How much did you make? No, it was not.
No. He's talking about the guy that actually had the injury.
No.
56
How much
million
did Henna
Sustained
Gracie-
the injury.
Yeah, what did
No,
Henna
we're not talking
Gracie
about the
pay?
pay. How much did Henna Gracie
This
get
is Hendo's first day on the job,
Yeah.
so
Get
he's
paid.
getting trained.
per hour? Like, yeah, how much did
Yeah,
he
to
build?
go on the stand.
Anyway, while
he
looks
built
that
the.
up,
What would you say? He built the court or like
he was billing the defense or the
I don't know.
the prosecution. He was billing the complainant. The complainant.
the complaint?
Hendo, can you please
No,
fact
there's no
check Nick?
prosecution. It wasn't criminal. It was
Yeah.
civil.
It was a civil
The
case,
complainant.
yeah.
But the guy won, and then Henna got a lot of hate for it.
Yeah, because he set the precedent in jiu-jitsu that's going to now
Okay, did you see the video?
fucking
Of the
track
guy
us.
that did his neck?
Yeah.
I haven't seen the video.
Yeah,
The black belt took this guy over his neck, and
Yeah.
I don't actually.
but it looked
remember-
like an accident.
I don't
It was a bit reckless, but it looked like an accident.
Yeah.
Yeah, there was a lot of uncontrolled body weight in that move. There was uncontrolled falling body weight in that move. So, why was the black belt doing that to a white belt? I don't know.
Well, obviously, he's probably performed that move
Maybe.
so many times and has never had this
But I'd look.
come up?
I remember thinking at the time, oh, that whatever.
Do you
I
think
was-
it could have been
I
more
was
so
against
how
Hannah.
the white belt reacted in the
Absolutely,
position?
and that's the
Didn't
thing.
know how to roll or turn in the
He,
position.
maybe he didn't do his neck conditioning. It could have been a lot of
Do you
things
think
going
neck
on.
conditioning could have saved this poor white belt this injury?
I don't know.
Perfect storm.
I think it could.
Perfect
Yeah.
storm.
Because
I think perfect storm.
sometimes I put Hendo in positions that would, generally disable most of the population, and he brushes it off.
Hendo is like a
We're
cat.
going to end up in a lawsuit.
Yeah.
How much did you make? It was 100K.
Wow.
3K.
3K an hour. Yeah. Wow. Yeah. So imagine billing someone $3,000 an hour.
At that rate, was he ever going to testify?
Mate, I'd throw you under the bus for 100K. Like, easy.
I think there was some stuff that came out about that white belt as well. Like,
Oh, really?
Yeah, like that.
He was a serial offender of
Yeah.
yeah, that he was
complaining
not so
an
much that,
insurance
but
fraud dude.
I think they claimed that he was like relatively really new, but it turned out he had actually a training history.
Yeah.
And had jumped around different gyms. So like it wasn't that he was like a fresh trials guy.
But
Yeah,
he also
interesting.
recovered. He also recovered from the injury. He wasn't quad.
But I believe, and I could be wrong, Hendo can fact check me, that
Hendo.
he's got he can hear us, brother. He's got the headphones on, he's tuned in. You've killed my train of thought now. That Hendo Gracie, I've forgotten now.
Hendo Gracie, I think, actually made a statement about it afterwards, and he made some good points, if I remember correctly. I don't remember what they were, though.
Anyway, back to physiotherapy.
Let's get back into Kevin's stories.
Worst injuries you've seen and had to treat.
Jiu-jitsu related.
Any related.
anything.
Let's go with any related.
Next. You said next.
Yeah, there was a
Can I
bad
take a
neck
guess?
Do you
before
remember my finger? Remember I dislocated my finger? That was pretty bad.
Yeah, that was like decently bad.
Or Raf's baby toe that got operated on.
The one that all you guys were playing with.
Yeah, everyone
While
was like, why is it
scratch
crunchy?
Did I play with it?
I think you did.
Maybe I did.
Yeah. He was grabbing my baby toe and we were moving it up and down and shifting. And he's like, Chris is like, it's making a crunchy sound. And we're all
Definitely not advisable.
And then Kevin texts me like, stop making the crunchy sound. It's probably broken.
But seriously, though, what is the worst?
Can I take a guess before you answer?
Yeah, go.
I would say a hip dislocation would be the absolute worst thing to happen. Obviously, excluding body part dismemberment.
Dismemberment's definitely the worst.
Have you seen that?
No, I haven't. Oh, actually, I've seen amputated, like patients with amputated.
Like treating phantom limb and stuff like that?
No, just more like the recovery, like post-op.
Yeah.
Yeah. But then
So yeah, go on. Worst injuries.
the worst one in clinic was there was this guy that he worked at the docks,
Yeah.
Port Botany.
Yeah.
And he was some sort of heavy machinery mechanic. And he was
I think I remember you telling
Did
me
I tell you about this?
I think I remember
So he
you
was,
telling me
the
this.
cranes
Yeah.
that they used to move those shipping containers.
Yeah.
Something dropped on him, right?
Yeah, he was down the bottom.
On his head.
Yeah, and there was some guys up the top, some of his colleagues, and they dropped like this component of the crane, and they should not have been like doing stuff up there while someone was
remember you
down
telling
there.
me, yeah.
And it fell, but he was like working
Hunched
like this,
over.
hunched over, and he had a helmet on, like thankfully, but the way it hit him, luckily,
Glanced
it
off his
just kind
head.
of, glanced off the front of his head and kind of like snapped his head down, and he kind of flew off the crane reflexively, like a cat, like he just kind of bounced off.
Yeah.
And so he had all these like multi-level disc injuries, traumatic brain injury, all this kind of stuff. But the crazy thing was, if it was just like an inch further back,
He would've been
just
dead.
crushed him like completely, like into a pancake, or even to the left, it would have just shredded his shoulder off or something like that. So it was actually really lucky that it hit him like on the head, on the dome, the way it did.
I remember you saying like neurological issues too are probably
Yeah,
some
so
of
he
the
had-
more serious because we were talking about that. I think leading off that was it not?
So did he have like brain issues after?
so
Like he
had-
couldn't speak?
He basically had like a proper concussion with like memory loss and
Yeah, so head traumas.
proper head trauma.
Surely you'd get a big workers' insurance.
No, but this is the thing though. I remember saying this to all you guys. Like, the insurance absolutely cheering because this guy wanted nothing to do with it.
That's crazy.
He just wanted to get better. This was actually what made me really enjoy working with this guy. He just wanted to get better and play with his daughter again. And he just wanted to fuck off. Like, as soon as he got better, he moved to Queensland.
No, but what do you mean? But the insurance would pay for all your
like
treatment and
he
your
got all
surgery.
his medical paid.
Yeah, okay. So he did go through.
Yeah,
He didn't
but,
get a
but he
payout?
didn't
No
get a
payout.
payout. Like
That's
he could
fucking
have,
crazy.
like
Milked it.
milked it back. Like he literally could have.
Yeah, why the fuck?
because he's got long lasting issues like with the
I
concussion.
get, but that's what I'm saying.
But
Yeah, but he just wanted to get out of it.
Pardon my ignorance, because obviously you know this guy and he seems like a good person.
Yeah.
But surely you're a dumbass for not like you have long
Yeah.
life issues
Yeah.
that you
Yeah.
are covered for by insurance. Why would you not?
I agree.
I
Take
think
the
there's-
insurance and cover yourself.
But-
At
but-
least get physio for the rest of your life covered or something. You
Yeah.
know what I'm saying?
Well, another thing too is like, how's he going to perform in another job?
Yeah,
Leading off
yeah.
the back of that. So why wouldn't you want insurance to take care
100%.
of? Yeah, exactly.
100%. If ever there's another issue that comes up, like say there's a complication, the insurance would cover you for that.
That's true.
He would be covered under that, but wouldn't he? Because there was an original claim. So
Yeah,
if there was
yeah.
something leading off the back of the
Yes.
injury, he would still be covered for any procedure or anything like
Because
that.
the thing is, like, I think my understanding is if you seek a payout, that's it. Like, so if there's any more
Yep.
consequences, they
Yep.
can't. Insurance won't pay for it because
Yeah.
they've already paid you out. So I guess that he's still got that option there. But
Yeah, that's true.
But they've actually done studies looking at this, like people that are on work cover or, any kind of CTP or whatever, their injuries take longer to recover. Now, there's many factors with that. Is it because of, wanting to seek a payout and like extending,
Staying on it.
Is it
staying on
the
it?
mentality of being?
Yeah, and is it that mentality, that like victim mentality as well?
Still on workers' comp for like a year and a half.
Yeah, or is it like a stress thing too? Because it's pretty stressful. Like there's
Yeah.
lawyers involved and there's constant.
How much do you reckon Australia spends on workers' comp a year?
Hendo.
Oh, this is the perfect.
But is it also like survivorship bias? So the people that are still on workers' comp for a longer time are the ones who are actually properly injured. Potentially.
Yeah, it's really muddy waters.
Yeah.
But just from what they've looked at with the data, the people that are like insured versus non-insured, they just tend to take longer. For whatever
Well, that
reason.
would make sense because if you're insured, you're like, fuck it. I can go to physio as long as I want, kind of like me. If you're not, you're like, I don't want to keep paying $100.
Yeah, so there's a
session.
financial
Yeah.
thing there. So like if
that would be
you're-
my incentive.
Every time I like picture anyone like prolonging themselves on like health insurance or any like sort of scheme like that, I have this view of this guy with a neck brace in court.
Like the Incredibles. You know?
But when he gets out of the court, he's just like taking it off, like and balancing off.
Do you have an answer for us? How much does Australia spend, Hendo?
Terrible at your job, Hendo.
$11 billion.
Yikes.
I want a piece of that pie.
Yeah.
I want a piece of that.
Yeah, we know.
Yeah.
He's like, oh, my pinky. Oh, you got to make a claim. Raf, open a claim for me.
I think I'm the only.
Have you
employee-
ever had a claim?
Never had a claim.
He's never had a claim.
Yeah.
You've had multiple claims.
I've had two. I've had a broken pinky toe and an ACL
Yeah.
and meniscus.
I should have made some claims. My
With
pinky.
the amount of ailments that you have.
But to be fair,
Pinky.
you should have 10 claims racked up because you did all of yours through work.
Okay, so like majority of the surgeries that I had, I did through my private health.
Yep.
So I had a great scheme with my private health because with my private health, I had an extra cover that I had added on that if I had injured myself, I could claim $5,000 cash in my pocket if I had to have surgery.
Right. Yep.
So any time that I'd put that claim in, they would give me $5,000 straight up. Plus, my surgeon would never charge me over the scheduled fee. So my surgeries would cost me, hospital excess was $250, and I'd walk away with $5,000 in my bank account, which you would never get in insurance. But again, probably should have done it through work cover because I'm paying out physio that's coming
Yeah.
out of my pocket.
Yeah.
Did they have cameras at Gracie?
Yeah, they
Oh yeah, they
On the
had
mats?
cameras.
But you don't need cameras. Like you really don't. Like
No, yeah.
honestly, like the whole process is weird. Like the work like when you get injured and then you put a claim in, it's like as long as like you like have some sort of a I don't know. Like if you're someone that racks up heaps of claims all the time and they kind of sound dodgy, they'll investigate you. They investigated my claim, but there was nothing they could say because we had cameras and witnesses
you had
and heaps
footage
of
and-
students and
yeah.
stuff. But like I feel like it's very like the first time I put a claim through, they didn't question anything.
No, they
were
didn't.
just like, yeah, they
What was the
approved
first
everything.
one? The pinky?
When I broke
little
my.
toe.
That's one they really should have questioned.
Why?
Why?
It was his pinky toe.
No, it was
But-
the metatarsal in my foot. It was
But
like
again,
a clean
like
break.
you have like people that are doing diagnosis,
Yeah.
professionals that are signing off on it. Unless you're finding some shonky dude in a back alley that's like signing off on things.
Well, you know how I don't know if they did this for yours, but they send someone to come check on you.
No, I
like
didn't have one
a
person.
case manager.
Rehab provider.
No
Yeah,
one
really
to
yeah.
send someone out.
Yeah,
They don't trust this guy. They're
Yeah.
like, something doesn't smell right.
I remember
So-
the lawyer came to the gym.
but I didn't have it the first time. But I had it the second. Well, actually, I did have it both times. But like, I had it way more the second time. They had checked on me
Yeah.
very, very frequently. And remember, she came for a coffee here, and we
I
were
do
asking her
remember.
heaps of questions, and we were like, and she was like, 85% of the people milk. Like, she gave me like around that number.
I hope you don't
Milk
mind
their
me
claims. Yeah.
talking about it, but one extra,
Talk about
extra
whatever.
factor I think that encouraged them to the insurer to send a rehab provider in
Yeah.
is because we went through the cross bracing protocol.
Yeah.
Yeah, because it's like
good to
still,
talk about.
It's still new stuff. Like
Yeah.
it's still pretty new. So a lot of the insurers don't.
It's like
really know about it.
pseudoscience.
It's new science. I should
I
say.
get what you're saying,
Yeah.
but I'm just saying to them.
Yeah, to them
So-
they're like,
You know what I
what?
mean?
Essentially, the insurers are saying, why aren't you using things that have been studied more?
Exactly. Like
Yeah.
Why aren't you going through the normal protocol?
the normal protocol that?
But-
99%
So wait, let's
You
get
had a really good outcome, though.
Yes, but let's get Kevin to break down, I guess, my injury and what a normal patient would do versus what. Because you can use Chris as an example. Like, there are three options as well.
Yes.
I took one option, Chris took another.
Yeah.
And I think we took the less conventional options
Yes,
versus
the
the most
newest.
conventional. So,
Yeah, so when most people tear an ACL, they're majority of the time they're gonna go and get a surgery done, especially if they want to get back to sport or just a level of function where they require like a really high. They're required to put high pressure on their knee. So most people would do that. So like all those Muay Thai guys, they're going back to contact, they're going back to pivoting and all that kind of stuff, change of direction. So that's option one, pretty standard.
and obviously that's quite an invasive surgery. Like,
Very invasive. So in Australia, most of the time they take a hamstring graft to
Yeah,
turn
we were
into your
talking
new
about this.
ACL.
So
yeah.
take us through that. So that's like taking a piece of the hamstring out.
Yep. So they'll chop the hamstring. Well, you have 3 hamstring muscles, right? Individual ones. They'll take one of them. So they'll take the bottom tendon out, and then they'll fold it in on itself, and then sew it up so it forms like a new kind of ACL.
Yeah.
And then they'll drill that through your tibia up into your femur, and then that becomes your new kind of ACL.
ACL, yeah.
And then over time, which they say is like over a year, that starts to turn into a new ACL ligament, and then it gets stronger and stronger and more, and starts to behave more like.
So you're
an
turning a
ACL.
tendon into a ligament.
Basically. yeah.
Crazy what the human body can do.
And the
And
usual.
sometimes you can use a donor. Sorry to cut you off.
Yeah. So you can use a donor as well. So that's like.
That's not more of a practice thing in Australia, is it?
not
In
not
the
as
States,
much.
they do
In
that
the States,
more,
they do
don't
that a lot.
Because I remember us talking about
And what
this.
pros and cons?
So with the donor, you don't. The pro is you don't have to use your own tissue. So
Yeah,
there's
rejection.
none of that secondary trauma from cutting out your hamstring, because your hamstring is one of the main stabilizers for your ACL.
Yeah.
So in a way, it doesn't really make sense to take away one of them.
Can they not use a quad graft?
So that's the other option.
Why don't
so,
I use the other leg?
Hang on. Let him finish.
so that's a good question.
That's a good
Like,
point.
That's actually a good
That's
question.
actually a good point.
Because my understanding is if you take the hamstring from the other leg,
Yeah.
you're kind of now just like really debilitating a person now.
But are you more debilitating the leg that's like more weakened?
Would you rather have one
I get you.
really
I get what you're
debilitated
saying. I
leg
get what
or
you're
two
saying. But it was a good
semi-debilitated
point.
legs?
It's a very good
It
point.
is a good point, yeah.
Thank you.
Then the other option
very valid.
is, a cadaver. So like
Yeah.
a dead person's
But rejection of tissue, right?
rejection, they have to irradiate it.
What's that mean?
They have to like blast it with radiation.
Right.
In case there's any pathogens in it.
Really?
Yeah.
I never knew that.
Because otherwise,
Isn't
like,
the knee like an ecosystem? We were talking about this.
yeah, but you can still you can still get infections coming across
course, of
from it.
course.
So they got to blast it with radiation.
That's crazy.
But what happens is it actually affects the structure of it. Like it
The integrity?
Yeah.
Yeah.
So Australia's standards are pretty high. In the US,
The
I
lower
think-
standards?
I would say that my understanding is that we go a bit overboard, like we blast the shit out of it.
Oh,
Whereas
we're
in
talking about with the curing process.
with the cadavers.
Yeah.
Whereas in the States, they don't blast it as much.
Curing process.
So it's probably a little bit more successful over there. It's a bit more
Because the radiation degenerates the cellular structure of the actual.
it breaks it down.
That's crazy.
That's the requirements of us doing it here. And then the other option is what Raf said, the patella tendon graft. But that's really crap for jiu-jitsu.
Yeah.
Imagine, because you have to kneel all
You
the time.
need your
Yeah.
But they could do cadaver patella tendon
That's a good question.
over in the States.
I'm not sure
Yeah,
if you
yeah.
can do cadaver for patella tendons, because I imagine because there's a bone element to it.
Okay.
Yeah. So when they take your patella tendon, they don't just take the tendon. They take the bottom middle third of your patella and the
Right.
bottom middle third of your tibial tuberosity, which is that little
So there's
bony bit
bone
along the
on
end of your
each
shin.
end.
Exactly.
Right.
So-
Right.
And so that might complicate it if you have to
Okay, I
blast
get
it with
you.
the radiation.
What's the future looking like on like ligament study, like ligament
Wait,
technology?
before we ask this question, can we go through
We're going through the protocol.
the options?
Yeah.
Yeah.
Don't
'Cause
sidetrack it.
Let's not sidetrack. Save that question in your memory bank, and then we'll ask it in
I've
a
already
second.
forgotten it.
That's good.
So option number 2 is no surgery.
Yeah, and so that was all option number 1. Option 2 is where you just treat it conservatively with no surgery.
Yeah, which
and that's
is what
what
Chris
Chris
did.
did. So
Yeah.
How many people can fall into that category? Because we talked about this. Because like when I came in, remember as I was saying, there was like 4 other dudes. They were all on crutches. They couldn't even hold themselves upright.
exactly. Yep. So a lot of those other guys, they had other injuries as well as the ACL.
That
so
was
they had
surrounding the knee.
Exactly.
Right.
They had like bucket handle meniscus
But I had
tears.
meniscal. Did I have meniscal tear later on? Didn't I?
Yeah, yours
did-
was after. Yeah.
Yeah.
So those Muay Thai guys had bucket handle meniscus tears at the same time,
Which
and so
contributes to the stability issues.
exactly, and they require surgery as well.
Yeah.
So you might as well just go in and do it.
Two birds, one
together.
stone.
Yeah.
I
Yeah.
get you.
And so in your case, what was unique about yours was that you had that isolated ACL tear with like basically nothing else, and you were pretty high functioning even from day one.
Yeah, I know.
Like that's why I missed it.
yeah.
Like when
I
you
remember.
came in,
Yeah.
so when Chris came in that day, he literally just walked in. He had like a teeniest amount of swelling. He
Yeah.
could squat all the way deep, ass to grass.
That's crazy.
And he
Crazy.
That's
had-
crazy, because
Crazy.
I could not even bend my leg
Yeah,
past 90
crazy.
degrees.
That was crazy.
And on ACL testing, on the Lockman's test,
Yeah.
where you test
There was
the
a bit of
laxity,
give.
There was a little bit of give, but like not heaps.
I had that too, and he said it was because we're pretty hypermobile in the knees.
Well, my knees are very lax. We talked about this. You said the only other person you've come across with more lax knees was that wrestler from Smeating Range.
me.
Yeah.
Yeah. And I was like, really? There's someone with more lax knees than
Well,
my
okay,
knees?
let me correct. So Chris's knee was lax, but not heaps more than the other side.
Yeah.
Yeah, like as a comparison.
Yeah.
Because naturally, when you test his knees, they have heaps of give anyway.
Yeah. And so,
So the tear was the ACL just not giving any stability to the knee with how lax his knees were.
yeah, so the idea is like, well, my thought process is because Chris was already really, really hypermobile through his knees, it meant, especially like into flexion and with rotation,
Surrounding tissue
your ACL was probably not,
functioning the way it should function.
or probably not super tight.
I get you.
Yeah.
I think I already had a partial in that knee. Like
You could have,
I
possibly,
think
yeah.
like if I look back at one of my scans, I know one of my knees had a partial in it. I don't know if it was my right or my left, but yeah, it could have been my left.
Yeah, we got a copy of Chris's MRI report once. Remember, Nick? We
Great
read it.
reading.
It was like 4 pages. It was like everything that could be wrong with the knee.
Was it from
wrong.
Castlereagh?
Yeah,
All mine have been
it was.
done from
Yeah, so
it was
Castlereagh.
like a full report from Castlereagh. It was very
Castlereagh
funny
is
to
the
read.
OG.
Yeah.
Yeah.
Yeah, their reports are super long, but
Yeah.
as a physio, though, like we like that
good,
stuff.
yeah.
We like
I've got a
that detail.
history with Castlereagh.
Yeah, you're a frequent
They've got
flyer.
a, very, yeah,
But I
they've got
just- I
a
think-
long history.
If I remember correctly, reading Chris's MRI report, there was a problem with every major structure of the knee.
Was there?
No, almost every. There
Right.
Almost every major.
Yeah.
It was-
Like some other
like
weirder things,
the
like the
meniscus-
patella tendon were fine.
Yeah,
and stuff like
yeah.
that.
But the
like,
meniscus,
all
horrible.
meniscus,
I
all
got very
ligaments,
degenerative
ligaments.
stuff
There were-
going on inside
there was
my
scar
knee.
tissue everywhere,
and
like-
yet still training.
yeah.
still bashing a lot of people.
Anyway, option
And then
three.
option 3
Yeah.
is what we did with you,
Yeah.
which was it's still considered conservative because there's no operation.
Yeah.
But there's a specific protocol that you follow. It's called the cross bracing protocol.
Shout out Tom Cross.
Yeah, shout out to Dr. Tom Cross.
And his dad.
And his dad, Merv Cross, who was a knee
dad-
surgeon.
And his mum, because behind every good man, there's
His dad invented. Correct me if I'm wrong, but his dad invented the ACL reconstruction surgery,
Merv
or like
Cross. Merv Cross.
you wouldn't say invented, but discovered.
I'm not, to be honest, I'm not 100% sure, but I know he was a really
And
good
He's one of the pioneers.
Yeah, he was a
check if-
pioneer in
He was a
Australia.
pioneer in
Merv
Australian knees.
Cross.
So
Can you
Merv Cross is a pioneer.
Can you check if Dr. Merv Cross was the guy?
I'll tell
who
you something crazy.
Invented
My
ACL
sister dated Tom
reconstruction?
Cross.
Did you know this,
I think you mentioned it, but I forgot
My
about it.
sister dated
bro?
him
It's
briefly.
crazy. He's like, it's like a. She showed you a
Well,
picture.
my sister once upon a time said, "Look, I'm seeing because of my knee history." She was like, "I'm seeing a really high end like knee specialist. So if you ever want to go see him, he's open to like talking about your history." Funny enough, when Raf went and had his consultation, with him,
Wait. Can I tell the story from my perspective? Because
yeah.
I feel like I went in there and then he was like, I was telling him about Chris's knee. He's like, man, I'd be so interested to
Yeah.
see. Can you ask him to come in so I can have a look at his knees, like for studies or whatever? And
And my
his
sister was
said
saying the same thing. So, he wants to meet you
When
'cause
were
he
they
said-
dating?
I can't remember. It was a long
a
time.
while
It was
ago.
quite a few years back. But
Right,
like
okay.
she was saying, he really wants to meet you because of the extensive history you've had surgically with your knees.
Yeah.
And I was like, oh, I'm not going to go see him. Like,
And now it's probably very hard to get in with him.
I think he'd still probably see me just because due to the history that I've had with my knees and the fact that I'm still so high functioning without an ACL.
Yeah. Yeah. So he
He was a
he
pioneer.
pioneered.
Yeah.
Yeah.
But a lot of athletes
Wait.
don't.
Can you finish? Sorry to keep cutting you
He's
off.
had a relapse on remembering what he's
Sorry, go on with the cross brace.
So,
I'm really sorry, Nick. I'm really sorry.
I'll finish this quick. So with the cross
We're
bracing,
actually not roasting you. We're actually like sorry this time. Go on.
so with that cross bracing protocol, it's very specific. So they want you locked into 90 degrees of knee flexion
In a brace.
in a brace for
to
usually
12 weeks.
around 8 to 12 weeks.
So they're doing 4 weeks now.
shorter.
I did see, they're doing shorter
they're doing
ones.
4
Why
weeks.
shorter?
And they're doing 8 to 12 weeks now, only at night, because they're trying to reduce the amount
A
of
time
like,
that you've braced into it.
yeah, and like the time, like how, what would be the word?
I
Like,
guess the burden on the
yeah,
patient.
the- how-
Does this also affect with the sort of like what's it called, muscle wastage?
Yes.
Yeah.
well, they want you. So now he had success. He's been having successful because I'm in the Facebook group. There's like a private Facebook
Yeah.
group with all the new patients that get added, and he's having successful gold standard heals, which is what he calls them.
With shorter protocol times.
Yeah, well, with protocols where people are just locked at 90 at night, so they have flexion during the day, and then when the body heals at night.
Now with that,
yeah.
is it just because you're more mindful when you're awake of what position your knees into when you're asleep?
I'm not sure.
Or is
Yeah,
it because
that
that the
plays a
body
role.
does more
Because-
of its healing, it lays down more tissue.
That's
at night.
also true.
Yeah.
As well.
Right.
The theory is that you obviously heal more at night, like you
Yeah,
just
yeah,
said. And so people are locked in at 90
Did you
degrees.
have gold standard healing?
Yeah, so he'll give you a percentage of what he thinks will be like. So he said to me, I reckon there's a 70% chance that your ACL will have a full heal, like a full reconnection. And then he said like your ACL is like 95% reconnected and it's surpassed the amount of tissue on the MRI that we would have thought, or it's less than the amount that we would have thought. And then he'll give you less of a heal. Does that make sense?
Yeah.
Yeah.
Yeah. So
He does everything through MRI.
everything's so he'll get you to get an MRI like straight away, and then he'll figure out if you're suitable or not.
Yeah.
So there were some concomitant injuries that kind of made you excluded from his study because this
Yeah.
is all in a study as well, like probably a paper that he's writing up. If you had any minuscule tears that required surgery, like bucket handles and all that kind of stuff,
It kind of
then
like alters
exactly
the study.
Yeah, and so you probably
Didn't you
need to
have
get
a tear?
that.
I did, but they couldn't see it on the MRI. It was so
It was
small.
yeah.
So if they had seen it,
I think
that
he
had
still,
excluded
no. He
you?
told me because I asked him, and he said he still would have taken because it was such a small tear, and I wasn't. And they thought the mechanical issues I was having was from the ACL, not the meniscus. Yeah,
So
but
you're in the study or no? Because you
Yeah, I am
also
in the
are on
study.
BPC, right?
yeah, I'm in the study. Yeah, we'll get to that. Like I am in the study. But because he thought the meniscus was bruising, if you remember on
yes,
the report.
scuffing, he
Yeah,
was
just
saying.
scuffing.
Yeah.
That's the word he used. So he didn't think it was a tear at the start. He's like, it'll heal, but it never healed. The tear got progressively worse through the MRI.
Well, that's usually what happens with meniscus. Right?
Yeah.
It's a very
It can
slow
progress
tissue.
over time. Yeah.
Sorry. So to address Nick's point, he also included me in the study, even though I was on performance enhancing drugs because he wanted to see if it would heal quicker, which he thinks it did.
There was
He didn't
another
even-
jiu-jitsu guy that was doing that too.
Yeah, I obviously don't want to say his name because
Nah,
it's
yeah.
confidential. Like, but there's another. Yeah,
And he had
He's
a gold
well known
standard,
in the
he had
jiu-jitsu
a
community.
gold standard
yeah,
heel too.
Yeah, he had an amazing heel.
BPC and TB500.
Yeah, and he did another one like a copper peptide. He talked
Right.
about.
Yeah, I remember you saying.
Yeah, and I'd never heard about it. Yeah,
I jumped on both those peptides,
and CJC.
even though I didn't have a heel.
Yeah,
I don't know if it progressed my
But-
healing rate.
yeah.
I got.
But you did still have your ACL stump did tether to the PCL, didn't
Yeah,
it?
connected.
Yeah.
But like I did it after my meniscal surgery. I jumped on the peptides.
Oh, right. Okay.
But again, like I was talking about the healing rates and like if I even knew significant change from the healing,
Yeah.
I couldn't fucking
I think
tell.
they'll still push athletes like footy players and stuff towards surgery because they know it works.
Yeah.
You know what I mean? So it's like, let's
It's
just take the
established.
safest option, whereas this was a bit of a gamble.
Yeah,
You know what I
it
mean?
was,
And it's still not like fully healed. So we still don't know how,
We
the
need that
payoff is gonna
long-term
be.
data,
Yeah,
right?
yeah,
like
yeah.
10 years.
But he's
worth
coming
of
up to
data.
1,000 patients now. It's like
a
when
lot.
when you put a Facebook post up in this private Facebook group for the cross bracing, it's like you put like number. I think I was like 6, 7, 8.
Wow,
And
you
now
guys are numbered?
yeah,
That's
we're numbered.
crazy.
We
Like-
get a number like an experiment, and then
Yeah,
now
yeah.
it's number 939 or something. So you're coming up to 1,000. Sorry, I cut you off before. What was you going to ask? Do you remember?
He doesn't remember.
Yes, I do actually.
Yeah, go on.
I do. A lot of athletes that I've seen, and just a lot of people in general who have done their ACLs, have elected not to cross brace and not to get surgery. They sort of live without the ACL.
Yep.
And they,
Who are these athletes?
I know Olivia Giles.
She had her ACL done, but
But-
eventually.
But didn't we just
Eventually-
talk about this with Chris?
No.
Yeah, so Chris might fall into that
Yeah,
category
yeah.
as well.
Okay, but they are.
Then Nicky Ryan had his ACL.
Sorry, let him talk.
reconstructed.
He's getting upset.
Yeah, I'm just saying.
Yeah, they're choosing not to do the ACL surgery, and they're not cross bracing either. They're sort of copying the injury and then just staying committed to their S&C program, and they're able to perform at a good level.
Yep. And I think the defining factor with that, and same with Chris too, like Chris falls in that category too, is the nature of the sport. Like if this was a sport that involved high speed running, change of direction, jumping, landing, like lots of that stuff, like basketball,
Directional change.
directional change, that it would be like
The
it would
funny
be
thing is you
quite
say
hard.
that, but I think when like if you got Brazilian style passing, like outside passing, you are laterally changing at speed. Those laugh. Do you know what I mean?
Yeah,
like,
yeah.
You're
But-
pivoting and turning.
Yeah,
I
but-
get what you're saying.
yeah.
Like high impact and there's
This
less chance.
Think of a full sprint.
No,
when do
for
we do
sure,
a full
for sure.
sprint in jiu-jitsu?
Yeah.
I don't think
Never.
it's a full sprint, but I'm just saying there is rapid directional change at points when you're
Yeah.
outside passing
Yeah.
to
But when you're wrestling, I mean,
Wrestling is
Yeah.
a big one. Yeah.
wrestling too.
So I do wonder how those people those athletes that I've heard of do that stuff, if they do it at all. Maybe they're playing guard.
But again-
then again in guard, someone grabs your pant and shoves it down, and you're trying to turn.
I've never had issues with people stuffing my foot to my ass, but like two of those athletes that you've mentioned have now had the reconstruction.
That's right.
Have they
Yeah.
really?
Yeah, so Olivia Giles had her done, and so did Nicky Ryan. They both had theirs performed on.
But Livia had hers done after she concluded her
I understand.
competitive career, and Nikki.
No, but I genuinely believe like that it does affect them in some way. Like,
So my other question was,
yeah.
how far are we along the lines of understanding whether or not we can just like put maybe a synthetic ligament in?
So they have done that before.
With
yeah.
what's it made out
It's
of?
called a Lars graft.
What's it made out of?
That's a good question. I don't know exactly what the fibers were made out of, but it was purportedly like really strong, like way stronger than an actual than human tissue.
Well, I remember us sitting there, and you're saying these are the options if they go into surgery.
Yeah.
Usually in Australia, it's hamstring graft or a Lars.
Yeah.
And what's the downside of a Lars graft?
So my understanding was like when because it was a trend. Like there was a period of time, I think when was it? Like 2000 and like late 2010s, kind of like 2008 onwards. Lots of people were getting it done.
Yeah.
And the idea was that you got that done, no trauma because there's no hamstring graft needing to be taken. They don't need to so you didn't need to go through all that rehab, and it was a faster turnaround, so you didn't have all that muscle wastage and stuff. And so people were getting back, but still tearing it.
So more reoccurrence.
Yeah.
Would that be because it doesn't act as tissue, like tissue, the flexibility and the mobility in the tissue?
Exactly. And
Yeah.
maybe part of that proprioceptive role, that biofeedback.
Yeah.
Because like every ligament that you have, right? It's got sensory organs in it.
Your body knows it's there.
Exactly. But it also like they kind of talk to each other, your nervous system and
Interesting.
the ligament.
Interesting.
It's got sensors in it which can sense stretch and pressure. And so you rely on your ligaments for information. That's why like you can do stuff on the mat with your eyes completely closed because you know where you are in space. Yeah. And the ligaments contribute to that.
So why not put a Lars graft in and put a hamstring graft
I
in?
don't think you can do both.
Because then you have the strength of the Lars
Well,
graft.
actually, good point you mentioned. So I know some surgeons.
You should be a surgeon, bro.
I definitely
ideas.
would not let this guy.
Some surgeons have been trying like using a cage. They call it a cage where they have like almost like a synthetic like outer kind of scaffold. Yeah.
Right.
And then the idea is
So we're saying they're putting a synthetic around the hamstring graft.
yes.
Yeah, okay.
And even I saw some surgeons in the US use it's like amniotic tissue. It's pretty weird.
What is that?
Yeah.
What is that?
So like I believe they get
Isn't that from babies?
yeah, like from
He's just like, he thinks he's so incredibly smart.
No,
Just your moment there where you're like, and he looked at me. But anyway, what is that?
yeah, so like they'll take tissue from I believe crap.
Oh, should we refer to
Yeah, Nick, help me out here.
Fill it in?
Is it aborted fetuses?
No, not aborted
my God.
fetuses, but the umbilical cords, umbilical tissue. Sorry, yeah, umbilical, like an umbilical tissue that wraps around it, and the idea is because it's got stem cells in it
Right, the
already.
growth factor.
Yeah.
Yeah, right. That's crazy.
So you can
That's absolutely
actually, I think that's an option in the US. You can, if you have
We're
a
hindered
kid,
by rules and regulations here, so they wouldn't be doing that procedure here,
No,
right?
definitely not.
It's
So-
crazy the things that are allowed
Put
in
an
certain
umbilical cord
countries.
in my knee. You know, that's what I would say. Put an umbilical cord in my knee.
Well, like again, like I would have to go through a procedure now where I'm sitting because my ACL is attached to my PCL.
yeah.
So
that-
even
is
if
that
I was
normal?
going to do,
normal?
Yeah, so if sometimes the ligament at stump, like what's left of it, can just attach to something next to it, which the PCL sits really close to it.
Like
Sorry, which sits really close to it.
so yeah, my PCL we said has been reinforced by my.
It's just
ACL.
like cable
Yeah.
gripped onto your PCL.
Is it just by any means necessary?
It's just
Hold
like,
on.
it's evolving. My knee's evolving slowly. Were we looking at one of the Meow brothers' knees, and you're just like, that guy has
'Cause-
nothing left in that thing.
Going back to your point, Nick, like, so say like the meows, right? Like, I bet you they have no ligaments whatsoever left in their knee. Like, it's just
Muscular.
support. Yeah, muscular support, and probably like the capsule. That's just like parts of the capsule that are just holding on. But
like
like
squids.
Yeah.
and yeah, they're literally like squid men, right? But then they're fine on the mats, but then in daily life, I bet you they're fucked. Like trying to walk upstairs and trying
I've
to
heard
like
stories.
Yeah, I
I've
remember.
heard
Yeah.
stories of them sitting on the side of the mat having bags of ice on their
So
knees eating
when I
lunch.
trained at Unity, I was waiting before class for class to start. This is at the old Uni gym in New York, and Paulo walks in. He wasn't training; he's just in like a singlet and shorts. Grabs his lunch out of the fridge and just sits down, and starts icing his knees. And I knew he was. I was looking at him like, "Is he going to train?" He just iced his knees and left.
Cool.
Yeah.
Okay, great story.
Thanks, man.
But I just
That
said
is a cool story.
yeah.
That is a cool story.
But like,
Unity would have been cool to train at the old
Yeah,
Unity.
well, I got the worst staff of my life at Unity.
fuck.
That was when they were training in the old Unity.
Yeah,
gym.
yeah.
If you go watch the flow grappling.
well, they were showering
Yeah.
in between rounds.
Yeah, no one showered in between.
Yeah, they were showering.
I don't know this.
to cool themselves down. You can actually see the old footage on Flow
Yeah.
where they'd
It's amazing.
all have a chain going into the bathroom.
And then they jump back on the
shower,
mats.
Jump back on the
But-
mats. And they would shut all the doors in there.
Yeah.
So the humidity factor,
Well, that's what it's like. It was
Wow.
literally like a corridor. It was probably this
like a petri
this wide.
dish of bacteria.
And
Damn.
I trained there once, and I got real sick from it.
Yeah.
Well, I heard during the camps they would just be, everyone would be on oral antibiotics, like just constantly
as a
training for
preventative.
staph infections.
That's fucked.
Yeah.
Wow.
Yeah.
So I have another question.
Yes.
How is it now? Because you're at a stage that I kind of envy where you're a dad who's put his son into jiu-jitsu recently.
Yes.
Talk us through the benefits of that you've seen, or like
Yeah,
why you decided to put Levi into jiu-jitsu.
So he's pretty crazy.
Yeah.
Like he's got so much energy. And so I remember talking to you about it.
Yeah.
Just full of energy. He just had problems like concentrating and stuff. And then I brought him in and he wanted nothing to do with it. Hey, like,
You say he's such a high energy kid, but when you first brought him in, he was so shy and reserved.
Yes.
So we didn't see that side of him. I think it's only recently he started coming out of the
opening
shell.
up. Yeah. But then, and then I was like, oh crap, this isn't working. But then you kept
Persistent.
Yeah.
urging me to persist. And like now, it took about probably like 6 months. And then he started to really,
I also think it
open
took
up.
him that long because he was so much younger than the other
Yeah,
kids.
that's true.
Yeah.
Yeah,
We
yeah.
brought him in early.
Yeah.
But at the start I was like, bro, this kid's autistic. Like he's crazy. Like he's for sure got something going on.
I didn't think that.
Well, I did because I've taught a lot more toddlers than
I was
you,
like,
Nick.
this kid is cute.
Autism can
No.
recognize autism.
Yeah, and I never said anything that he was. He was definitely cute. But now that he's
Yeah.
been consistent,
Yeah,
he's like, he's still a bit, because he's still young, so he's still a bit
Yeah.
slower with the movements.
Yeah.
But he's so well behaved. He listens to me.
Yeah.
Like he asks questions. He's very engaged.
He's a
in the
beast.
class.
This kid's a
So
beast.
I guess have you seen a change at home from jiu-jitsu or like?
Definitely. Yeah,
Oh, yeah.
yeah, definitely. Like he's just way more calm. He'll do his jitsu moves at home
Yeah.
as well, which is really cute. Yeah.
Is that what he calls it?
Yeah, that's what he calls it. Yeah.
Yeah.
So and I think it's helped because he's been forced to interact with kids his age
Yeah.
and then you guys as
Yeah.
well. So it's good for his like kind of social development
Yeah.
too. But he's just way more coordinated now because he's like, okay, I go down these big rabbit holes, right? And he's got my genetics.
Who started you on rabbit holes, Kevin?
We'll get to this.
So he's got a big head, small shoulders, long torso, and tiny limbs.
Yeah, he does
And
look
so
like a T-Rexy. Yeah.
He is very T-Rexy. And so it's really hard to do a forward roll if you're like that. Because like...
Especially as a
imagine-
toddler.
Especially because it's toddler, but because of those proportions, like he'll put his head down and he has to push like
Off his
so
feet
hard
to
off
get
his,
over
of his
his big
short little
head.
legs
Yeah.
to get over his big head and long torso.
Yeah.
But since he's been doing jitsu, he's like way more coordinated,
Yeah,
which is
That's
good.
amazing.
That's great.
And speaking to the autism thing as well, so we did take him to get checks and
Yeah.
stuff. And then while we were just sitting down, like Jackie and I were looking through the checklist, I was like, fuck, this is actually me. Like going through every little box.
But I think we all have to some degree autism, but you're not if you were, bro, you would be so high
Functioning.
Yeah.
I was going to say.
I'd
Rap's
say
high functioning.
I would say me, Chris, and Nick are way more autistic than you.
I'm not.
What? You are autistic.
We're not.
reckon?
No,
Yeah.
no. We're normal.
Why am I more autistic than Chris?
What did you ask him at the start of class? At the start of
Well,
this?
we
Do you
were
like
talking
Pokemon?
about Pokemon.
You like Pokemon? How much? do you like
Pokemon can't be a defining factor to
Yeah,
autism.
no, it can't. You can't.
Yeah, like-
like I get it. Like it's
But
there's
the
been
way you
something
like
that
it.
significantly has been like
The way you like it is.
Yeah, the way you
I wouldn't
like
say you're
it, so-
autistic. I'd say you're ADHD, which is on the spectrum.
no,
of
no, I'm
autism.
definitely ADHD.
Yeah.
I've been diagnosed
Okay.
ADHD.
Yeah.
I think I'm just perfect.
I definitely have like concentration
no
issues
ailments.
to a degree.
You have developmental delay.
I agree with that.
Down
100%.
syndrome. Yeah, something like that.
So
I don't
what?
think you're a Downy, but like maybe you got glanced by the Downy bullet.
I'm gonna have to cut that.
And it was like, that's not getting cut.
What level of like how deep are you into Pokemon though? Like do you like Pokemon because they're cute and they
He
look like
collects
animals?
cards for
Can you
assets,
name every
financial
region
assets.
that each Pokemon is from?
No, but when I was playing the game, I would fuck with I'd be like, okay, which Pokemon has the best stats? Like which one is Okay, so a lot of people play Pokemon, for those of you that know Pokemon, and they'll be like, this is the fucking coolest attack because it's got the most power. But I'd be like, nah, bro, you got to put your defense up, and then you got to do this, and then you got to do that, and that's going to get you the easiest path to victory.
See,
I'd start calculating
I would
and
just
shit.
pick the highest power move.
Yeah.
The coolest sounding move, and I'd hit
that's
him.
what the casuals will do.
I wasn't a casual though. I like
well,
Pokemon,
obviously
but
you were, bro.
I think
Got
you approach it differently.
No association to Pokemon. I used to come home and see that shit on on TV, and I'd be like,
Don't get me wrong.
fuck is that?
I'd often pick the Pokemon in my bag, like, based off how cool I thought they were as well. But when I wanted to win and speed run the game, I'd be like, nah,
I would only ever catch and train male Pokemon.
like,
Makes sense. Definitely makes sense.
But I don't think that's autism.
so it's just
Gayness.
But homosexuality.
Cloaked.
We went to Singapore for ADCC trials. We flew with Scoot. We left at maybe 10 p.m. at night, and we got the Pokemon jet, which is a jet with Pokemon library.
It was so.
Was he frothing?
He was frothing it.
No, bro, I wasn't even, dude. We're waiting in the like at the gate, and Nick walks off to do something, and I'm just sitting on my phone, like on the seats before we board, and I just hear him running over, and he's like, "We got the Pikachu jet! We got the Pikachu jet!" And I'm like, "No way!" And we get on, and they've got like Pokemon headbands. Yeah, they had like onesies and stuff. They were dressed as Pikachu on
the flight attendants.
Yeah, it was so funny, bro. You got like a little
Who
meal.
runs that airline?
Scoot.
But I'm
They're
saying
part
what
of
country?
Singapore
Oh,
Airlines.
yeah, they're part of Singapore
Singapore
Airlines.
Airlines,
Yeah.
And great budget option, much bigger seats. They give you
Nah,
money.
bro, it's shit.
It's shit.
Really? Like
That would
it's
have
good.
Asian.
He was probably
like,
just
people
frothing on the fact that he was on this airline.
But great option if you're cutting weight, because they don't feed you and they don't give you any water.
Yeah, he was fucking asleep the whole flight. I ate something, bro. They
No,
came around.
they
with
don't feed you.
They come
He
around
ate
with food
something.
options.
We have to buy it.
Yeah, but like
They don't give. You have to buy what you have.
he was like he was dead asleep, bro, the whole flight.
I brought my own food on the plane.
Okay, that's great.
I can't remember what you brought, but you
Now
did.
that actually is a good point. We need
Did
to
you
bring.
pack Macca's burgers or something?
Macca's grilled chicken wraps because I was cutting weight. I couldn't.
Yeah.
Obviously.
No, yeah, we were cutting weight and we get to the airport and I'm like having like beans and like a bit of tiny bit of chicken, a protein ball. That's what I had. Protein ball with a bit of peanut butter from the airport.
Guys eat Macca's.
And this guy comes with a full Karaage chicken rice bowl.
Oh,
Yes,
that was
was.
pan packs. That
No,
was
that
pan
No,
packs.
that was when I remember him telling you.
That was international airport with the Maccas. I remember, they have the Maccas that takes the bags up, and you came back with a full Karaage fried chicken with soy sauce. And I'm like, bro, you're
no
gonna
soy
make.
sauce.
sodium.
I was cutting weight. I couldn't eat soy sauce.
Okay, well, he had fried chicken.
I think it was grilled, but
It's not grilled; it was fried.
there's a few benefits to eating Macca's on a weight cut when in a foreign country, which is you're not going to get food poisoning. Usain Bolt used to eat nuggets when he was at the
Really?
Olympics, because he didn't want to eat random food that he didn't
Like it's
he wasn't
deep
used to.
fried. It's
I know
he knew what it
such
was.
random
Yeah.
facts,
He knew what
honestly.
it was. And especially if you're in like Thailand. I mean, Singapore's pretty safe.
yeah, Singapore's safe.
Can you look that up for me, Hendo? That
Is Singapore
Usain
safe?
Bolt
Yeah, look up.
was eating
Chicken nuggets.
chicken nuggets. Please look this up for me. Where did you even find this out?
I just know.
I feel like you make this shit up, honestly.
Well, we'll see.
Anyway, what were we talking about before? Autism. Yeah. So I can't say that Pokemon is defining factor to autism, but definitely being really intricate with it.
yeah.
What
And
are some physiotherapy interventions for autism?
well, we actually
He did.
I didn't. Did I make it up or am I right?
What?
He would need a lot of calories.
He would, yeah.
That's
At
crazy.
the 2008 Olympics? 2008 Olympics.
Where did you find this out?
He didn't want to eat Chinese food. He
Shout
wanted
out
eat
to Nick
nuggets.
for finally getting a fact.
Oh, this was
Yeah.
in Beijing, right?
Look,
yeah.
he's got a strike rate of 5%.
That's not
We did
true.
a percentage once, remember?
Yeah, mate. The strike rate is
It
very
was
low.
low, yeah. Anyway, sorry, go on.
Already today I've been right about the amniotic fluid,
Okay.
chicken nuggets.
Physiotherapy interventions for autism.
Yeah, so a lot of kids that have pretty high level autism, they usually have other issues as well to do with say contractures and stuff like that. And so they'll need
Coordination, development.
coordination issues. So they'll oftentimes need heaps of different services like OT, speech as well, if they have speech issues
I know
too.
this is a big common one.
Yeah, so there's actually a lot that physio can do for young kids with autism in the beginning, but it's one of those things that you really want to catch it early, hey?
Of course.
So like getting like
Help
early
with
diagnosis.
development.
Yeah. Like the earlier you can start where their brain is still developing and their body's still developing, like the bigger positive impact you can have.
That's why
So
jiu-jitsu is so good for them, just because it covers us.
Yeah,
just
yeah.
array of things inside of that.
yeah,
social
coordination, social,
Doing everything.
There's so many things there.
yeah, and building that self-esteem, I think, is probably a big one.
One thing I've noticed with the kids who started when they were your son's age, when they were Levi's age, once they've got 2 or 3 years of training under their belt, they're freak athletes, and they're not obviously they're not putting
What
like
category
numbers
are
on
you
that.
putting your son in?
I would disagree with that.
No, well, okay.
Yeah.
Think about
We have some
Bro,
kids,
I've
bro.
been teaching for
Yes.
nearly
Fully-
16
Let me
years
finish.
now.
Let me finish.
Struggling.
Let me finish. If you have a kid training from a young age, and they train properly for 2 or 3 years, they can do things naturally that adults can't do naturally, and other kids can't. Like they can wrestle intuitively. They base
It
themselves.
depends. I think it really depends.
It's-
Like,
yeah, if they're not
broad
trained-
spectrum,
their
Nick.
coordination definitely increases.
Yeah.
But like it
I think
to
from
say
such
they're
young-
freak athletes,
No,
bro.
they're not- I
We've
mean-
had people train with us for like
but
5 years, and
that-
we're like, man, this
alright.
kid just
I
ain't
saw-
never getting
with
better.
Some people just can naturally adapt. It's such a broad spectrum
Yeah.
from what I've noticed
Yeah, I
in
agree.
the years that I've done.
No, I think most.
How many years of coaching have you done, Nick?
I don't know, damn near 10 now.
10 years of coaching.
That's more than me.
Yeah.
No, you haven't, Nick. No, you haven't. You're such a liar. You can't even look that up. He's a liar.
Look it up, Endo.
He's a liar. Yeah.
Yeah, he hasn't been training for 10 years.
bro. Come
Probably
on.
what, 3 years?
3 years you've been coaching. I've been coaching
4
kids
years.
since I was like a 3-stripe white belt.
All right, we'll say 3.5.
So nearly the duration of my jiu-jitsu career I have taught.
Yeah.
And mostly with children. So I've seen there's such a broad spectrum.
And kids are getting more and more retarded.
I agree with this. Raf made a good point with COVID lockdowns and things. I was talking about this with Baby Dave.
This is actually my wife's take. That's where I got it from.
Yeah, and we've heard about this. We've heard studies are coming out now because of that significant time loss inside of COVID lockdown.
Yeah.
So
And I think there were like US CDC figures. I know we have opinions about the CDC.
Yes, we
do. but
how did I get you on this?
we'll get to that in
Yeah,
a
yeah.
few minutes. But I think it went from something like 1 in 50 cases of autism in children to like 1 in 36 or something.
But is that not because we can just detect it better? And
Yeah,
bar for
exactly. So that's one factor. Our detection methods are better. Like more parents are onto it now. So that will
Back in the day, you'd just be like, nah, this kid's retarded.
yeah, like and you just be like, oh, this kid's
That's the
like,
technical way that they would
Literally,
diagnose
that's
you.
what it used to be called,
This-
mental retardation. That's what it was
yeah.
called. Like,
So
I get ya.
Yeah.
I'm just saying.
yeah.
And then the other thing as well was I think their criteria has changed. So like it used to be a little bit more specific, but now it's become a bit more broad as well. So like I think that's changed as well. But in my opinion anyway, like I don't think that's enough reasons for the amount of escalation that you've seen in the numbers, in the frequency.
I
like
get what you're
there's still other factors.
Has to be the microplastics, eh, Kevin?
So
You're
I've-
obsessed with
I've been pretty
microplastics.
deep down this rabbit hole, but yeah, environmental factors. So like pollutants, toxins, but then there's other factors as well, like lack of social development. So like COVID lockdowns and
They were
kids
saying
being stuck
masks with
inside.
people's children developing and seeing facial.
Well,
Not recognizing social.
To that, my
cues.
wife was saying, because my wife's a kindy teacher,
Yeah.
and she was like, it was impossible to teach the kids with a mask because they can't see your...
social cues
Yeah.
and things like this.
So like when they're learning words, they need to see the shape of your mouth and what your tongue's doing, and that's how they pick up on it.
Yeah.
And they just couldn't get the words.
this is a huge visual aspect to
Yeah.
learning,
Yeah.
right?
And don't forget screens. Like screen time now
Screen
is
time's
next
huge.
level. Hey,
Yeah.
like
100%. Well, think about like through COVID, they would have been doing online learning
Yeah.
because they couldn't go out. They would
Yeah.
have been stuck in front of screens.
Yeah. Well, they were. Like imagine doing a
determining
kindy
factors.
class on Zoom with 20 kindy
The
kids.
attention
Like,
span
How
and
could
something
you?
like
I
that
don't
too.
understand how you could. How
can't.
can you get a kid?
well, it was done.
Like, but
But it was cool.
We're just talking
Yeah,
about
yeah.
the interaction.
No, I'm
sort
saying
of
how
like
could you? I agree with you.
statistics.
It was done.
but how was it done? Did it? did anyone learn anything?
No,
I
it's not
don't
effective.
really know. Like
I was at school during
We'd have to ask
COVID.
my wife.
I was at school during COVID. My school went online. I didn't attend a single.
I forget
Things
how
are
young
starting
he is.
to add up here with Nick.
I'm just saying, I didn't personally attend a single online class because I thought, well, there's no point.
Things are more starting to add up here with Nick.
he's upset. Yeah, I get you. But we're talking about kindies where the parents force them in front of the computer. You know what I mean? Your parents didn't physically sit there and restrain you to a chair and go sit and learn.
I just started lifting.
Yeah.
That's when I started lifting.
Yeah. Okay.
See, the COVID lockdown was good for my development.
Wasn't for your belly.
I got a bit bigger. Yeah. It was sick.
Actually, I saw a photo of you last night with two students that have sadly left us. You're looking a bit plump in that photo, Nick.
I'm bulking.
Yeah, he's got a bulk
Fair
for the
enough.
street
I know
X
he's
tournament.
bulking for the street eggs,
No,
but
I'm bulking.
I just saw you with a like a belly, and I was
Yeah.
like, it's like
Yeah, everyone's like, oh,
have
it's gotten big.
I have gone a bit more down the.
You've also got a girlfriend now. This doesn't help, does it?
Yeah.
That's
Eating a
not
lot
helping.
more
Yeah.
desserts.
He has Shabbat every Friday and they're eating big meals
He's
and
not
stuff.
going to have a
What's
I thought that's
Shabbat?
what you do.
No, we on Fridays.
Yeah.
Oh, no, that's what she does. Yeah. And
I thought
I'm-
you guys have a meal, you tell his
last
missus.
Friday. Yeah, last Friday we had a. We don't do it every Friday.
Oh, I thought you did. Sorry,
we're
my
gonna,
mistake.
we're gonna start doing it every Friday.
Oh, so yeah.
Just eating a lot more
Just in
desserts.
general.
Yeah.
Just
He's
in
like, I
general.
cooked a whole matcha tiramisu. We ate the whole thing.
There you go.
Yeah. I can-
Hey, look at. I think it's a natural thing that happens when you get a missus.
Luckily, I'm not trying to cut right now.
No,
When I cut, we'll see if I can get them.
Yeah.
I think I can.
He's going to struggle.
I don't think I'll struggle.
We've talked about you and your eating habits.
Yeah.
Do you have bad eating habits?
You're actually looking pretty trim now.
Well, that was because of the meningitis, though.
On the brain,
Did I tell you?
No, I haven't seen you for ages.
Yeah, I told you.
I haven't seen
Did
you for ages.
No, you didn't tell me either.
tell you?
Very
No.
close to death.
Like,
What?
No, I wasn't that bad. But like about 2 months ago, I see this is the thing, right? When you have kids that go to daycare, they bring home so many diseases. So
So I don't put my kid into daycare.
yeah, well there you go.
Yeah.
There's a benefit.
And Elliot
There's a
just took
benefit.
his kid out of daycare.
because of
For
this
that
reason.
Yeah.
For this reason.
Kid was always getting sick. Like
So-
bad sick, hospital sick.
Really? Oh, that's sad.
Yeah, like 3 times in like 3 months or something.
You got something called rhinovirus.
Yeah.
Have you heard of this?
Yes, I have actually.
Yeah.
Of course. Yeah, they've got every animal virus. Yeah.
So meningitis.
Yeah.
So you contracted this from Levi.
So Levi brought
What is
home.
it? Pardon my ignorance.
I've never had it.
So it,
Can I have some of your smelling
yeah, of
salts?
course. Asian smelling salts. So you've got this tissue around your brain and your spinal cord called the meninges.
Yeah.
So that got inflamed.
Yeah.
Is
So
it dangerous? I've heard of
yeah, it can
meningitis before.
Yeah, so some types of it can be. Some types can be lethal, but my one wasn't, thankfully. So he had gastro that he brought home from daycare,
Fucked.
and so he had he was
Chris knows about
vomiting and he had diarrhea, and then what the doctors think is he passed that virus to me.
Shedding.
So, yeah, so it was called enterovirus. So I had it, but because I've been chronically sleep deprived with
Your
a shitty immune
was
system,
down.
yeah, and it just went straight to my brain. And
Fuck,
then
I've heard this.
Yeah.
Yeah.
And so
Super
Did it
dangerous.
swell?
yeah, so there was
That's what you
swelling
get
in
from
the
meningitis. You get brain swelling.
yeah, and
It's
crazy.
Like,
I don't think you see like cranial difference from
Like mega minds.
but I did have
high temps.
fever, sensitivity to light.
Yeah, I've
and
heard you get
sound.
visual issues.
Yeah, so I had to wear an eye mask.
It's like having a-
that's
I had to,
It's like having a concussion almost.
yeah, like a bad one, and then really strong headache as well.
Yeah.
And so went to so this is a story with that, right? So I thought it was a concussion because I had sparring, like Muay Thai sparring on the Friday. And then I was like I did take a few knocks to the head, but it wasn't that bad. And I was sparring like Emma and Matthias, you know,
Matthias is strong.
yeah, Matthias is strong, but I was,
Yeah.
and but it wasn't that hard. And we were wearing 16 ounces and stuff. And then the headache started to set in on late Sunday night. And I was thinking, fuck, is this a delayed concussion? Because if it is, I'm not telling anyone about it because of my ego.
At that
And then-
time, did you have a high temp or was it just
no, not yet.
just getting a slight
yeah,
headache? or
just a
something?
headache.
Yeah,
and then when I woke up on Sunday, I had massive headaches, the sensitivity to light and sound. And then I remember sitting there in bed thinking, fuck, like,
Got a bad concussion.
I've got a concussion and I have to tell, like, I could possibly need to take the day off work. I'm going to cop it so bad from SportsLab that I got concussed by Emma. I was thinking, fuck this. I'm just going to take heaps of Panadol and
go to
obviously-
work.
Yeah. But then the fever started and I was like, oh, fuck, okay, this is probably not a concussion.
Yeah.
And then when I got to the hospital, they were like, look, we think it's meningitis. And there was a small part of me that was like, oh, thank God. Like, it's not a concussion.
By a girl.
Yeah, by a girl, it's
Inflicted by a woman.
meningitis. I was like, oh, good.
And then it proceeded to get much worse.
Yeah.
So did they maintain you in hospital? While you
Yeah,
had
so
it?
I was there for 4 days.
Dang.
They put you
Yeah.
in bed for 4 days.
Yeah, I had to go to the infectious disease ward.
That's
course.
crazy.
Yeah.
Been there a few
Has-
times.
Yeah.
They're in a hazmat suit
That's-
and they come and get you.
Well, it wasn't that bad, but I needed
Which
to be in
ward
my-
were you in, bro?
I was in the real.
The AIDS one.
Okay. They don't use hazmat suits when you have AIDS.
He would know.
He would-
Long how we just can turn it like back on you.
Stigma.
Relax. Anyway, let's go back onto your story. 4 fucking days. That's
Yeah. And then I needed to take that whole second week off work, like when I came out of hospital, because I was so, like, the brain fog was insane.
Yeah.
Wild.
I can imagine having your brain
Well,
you-
yeah, well, that's
Look how far
like the lingering effects of the infection. So, like, brain fog was insane. I got tired walking my dog Donut around
you're
the block.
You'd get lethargic.
Yeah, I got
real
tired just
fast.
from walking
Yeah.
that. Yeah, and then so I was like, okay, I need to have a bit of
Donut's
a long
high
break.
energy, bro.
He is high energy, yeah, but it was just like it's probably only like 500 meters.
Yeah.
and I
Did
was
you think?
gassed.
Did you think I'm never gonna be the same?
No, I was pretty confident it'd get better, but I think part of it was the heavy antibiotics too. So
Yeah.
they smash you with heavy
But
antibiotics.
meningitis.
Yeah, and
Meningitis is a bacterial infection.
so it can be. So
Oh,
yeah,
yeah.
that's part of the diagnosis process. So they have to figure out is it bacterial or viral? Because
Viral.
bacterial can be deadly.
Yeah.
Viral gets better.
Is that the more common one would be viral, right?
I believe so, yeah.
Yeah.
And then, but just to be safe, because time is of the essence,
Yep.
they'll just pump you with
Antibiotics.
super strong antibiotics. So I think that took it out of me as well. So
Being in hospital for 4 days, like I've done an 8-day stint in hospital, is the most
pretty depressing,
For your
hey?
lungs?
for my lungs, but it's the most depressing thing.
Do you think so? I've like not minded my hospital.
No,
stays.
like okay, where I was in a public ward when I had my lung
Yeah.
operation.
Yeah.
And they are like public is cool. Public, you got nice rooms. The atmosphere is just completely different to a public hospital.
Private.
Were you in?
You're talking about private.
Yeah, private.
Yeah, yeah,
To public.
Yeah.
Were you in public? Were you in private?
no, I was public.
It's fucked.
Yeah, all
It's
the
so
crazies
depressing.
were out.
Yeah. Which hospital were you in? Were you
I was
in
in Prince of Wales.
Ramwick? Good
Yeah,
hospital.
yeah.
I had a fucking prisoner next to me when I first got in there, cuffed to his bed.
Yeah,
Yeah.
same.
Oh, did you?
No, he was two beds down. But get this right, he was mostly okay, but then like
They get them from Long Bay, don't they?
he
from
must have,
Maroubra.
yeah.
Yeah.
And then when it hit like midnight, I don't know what happened. He just started to go crazy. Hey, like he was refused.
The lunar cycle.
Yeah. It might have been the full moon too. Who knows?
Yeah, 'cause that's what they say with the loony bins. That's why they call them loony bins. Is the lunar cycle. How crazy is
And the
that?
nurse was trying to change
'cause
like
they were
his
lunatics.
IV meds, right?
Yeah.
And then the whole time he was like, wait, and he was giving her a really hard time. It was this like small little Indian lady, and he was like, wait, and she's like, what? What do you want me to wait for? And he was like, wait, did you know that the Chamber of Secrets is here?
It would have been entertaining.
It was actually really funny, but it was keeping me awake.
Yeah.
And he was so funny. But by the time she got to me, because she looked after all,
She's
She's
so
exhausted.
done.
she was fucking over it. And
Yeah.
I had to get these, I actually had to get peptide injections.
What were they giving you?
Subcutaneously.
Subcutaneous
What
in my
peptide?
gut because of, what was it? It was an anticoagulant, I think.
Yeah, okay.
But anyway.
Just because you're bedridden.
Because I was bedridden because of all the meds I was on.
Right.
I needed to have them. And so But because she was so fed up from this prisoner guy
She was
ranting
short
on
with
about
you?
the Chamber of Secrets, she came up to me, right? Like, so imagine I was laying down and I had an eye mask on. So I had no clue what was going on. So she just went up to me. She just went, and then just whack, jabbed it straight in with no warning whatsoever.
So you're like,
Yeah, I was like, and I was like, bitch, like, I'm the only normal one here. And you're fucking treating me like I'm the most craziest one.
Yeah.
I must have got an experienced nurse who had been dealing with this because
Right.
the crazy I had was cuffed to his bed. He had been brought from Long Bay, and all he was talking to me, because it was just us two in this room, and all he was talking to me was, is it a catheter that they stick in your dick?
Yeah.
So he's like, don't let them put a catheter in you, mate. They're fucked. I'm dealing with this. It's horrendous. I'm like just about to go into surgery the next morning. So all I'm hearing, because this guy would not fucking sleep, is about this fucking catheter that he's dealing with. So I'm just like, holy fucking shit. Anyway, the nurse that I had, she was super tolerant. She must just be a nurse that had been in this ward for so long and had experienced this, because she was so kind to this guy. This guy was so abusive to her. But she was cool with me. Like, I just remember going in the night before this surgery, and the next morning when they were wheeling me in, I'm just like, please don't put a catheter in me, because I've never had one. So I'm like, please don't put one in me. Last night, this guy is just putting this into my head, how torturous this thing is. So I just didn't want one.
Yeah, my dad had one recently and he said it was fucked.
My surgery was like...
And he had to keep it in at home for a while.
Oh, really?
He had to bring the bag with him, and empty the bag and shit.
What did he?
He had his prostate removed and his gallbladder removed. Yeah.
Ooh, that's heavy.
Well, my surgery was like lengthy. It was like 2.5 hours long. So like, I was surprised they didn't put one in me.
I think because you're young.
Yeah, they didn't have to put one in me.
Yeah.
So when I woke up, first thing I did was, bro, I had drains coming out of my chest, and I'm just like checking my dick. I didn't give a fuck about the tubes coming out of my chest. I'm just checking my dick.
Yeah.
Yeah, apparently pulling it out is...
But this is what I heard.
Yeah.
So this guy was just like
Yeah.
screaming, carrying on. But what an experience. So I feel like we had a similar experience.
Yes, yeah. Oh, but he was the
The kicker.
the main highlight. The one next to me, the one like right next to me, in between the Chamber
You
of
had
Secrets
two
guy.
groups?
No. He was a priest.
A priest, yeah.
Yeah, and like you could hear from the way he was speaking, educated guy,
Yeah.
like really
Lucky
eloquent,
you-
older guy.
Lucky you were an underage child.
Yes.
Oh my God. Yeah.
And so he was in because he had, I don't know what the medical term is, but like a twisted bowel, essentially.
Holy
like that's pretty bad.
That's
like
fucked.
like when dogs get it, like they're
die.
gonna die.
Yeah.
Yeah. And so, but he was starting to get delirious, maybe because of medication and his age and whatnot. But
You'd be at risk of like septicemia and shit.
yeah,
wouldn't you?
like if it
That's-
ruptures,
yeah.
like you're gone.
That's big time.
How do
Yeah.
they have to cut you open and undo it?
Yeah, they got to go in there and actually like
Physically turn it or
yeah,
something, yeah.
and so the surgeon came in and he was like, "Look, we have to take you in tonight. Do you have any questions?" And the priest was like, and he was like a really sweet old man. He was like, "Yes, I do have a few questions. Could you care to tell me about the pros and cons of this surgery?" And the surgeon was like, "Okay, pros, we can get you in tonight, so really fast.
Yep.
You'll survive. Cons,
Colostomy bag.
you will probably die." So he put it
What,
that
long
way.
term?
Yeah, like you'll probably die soon.
How old was he?
He was probably like 80s or something.
Okay, yeah. Okay.
Yeah, and then the priest was like, is this colonoscopy widely accepted in the community? And he was kind of like,
Being rational about the situation or logical.
yes, but he was kind of like, there was a lot of umming and ahhing, and he was sitting
Whether
on,
he was going to do it or not.
so what the surgeon eventually teased out was that the priest was reluctant to do the surgery because of
His beliefs
because
and healing.
no, because of the nature of a colonoscopy.
Oh, right. Oh,
Butt action. Yeah.
what the fuck?
Yeah, he was.
Oh, right.
He didn't want to do it because
He
they were
felt
going to
like
have
he was
to
losing his anal virginity.
possibly. Yeah,
Fucking
yeah.
wild.
And
Did you hear him?
Yeah,
admit this?
so I had my earplugs out, and I was like, I felt like I feel like, bro,
was
just
like-
do it.
Yeah.
I felt like actually just speaking up and like,
Yeah, yeah.
come on, you got to do it. Like you're gonna die.
yeah.
yeah. And
So Hendo's agreeing with the priest.
What do you say?
It's sodomy.
yeah.
But like, wait, so he's gonna die from the surgery.
No, he was gonna die if they didn't do the surgery.
Oh,
Like
right.
eventually, like he would get so backed up.
Yeah.
Of
course.
Twisted.
Yeah.
Wait,
yeah.
what was
So-
the cons? You said cons, you're gonna die.
Yeah,
Cons
the
yeah,
surgeon
yeah,
said-
if he doesn't do it.
The con if you don't do the
Yeah,
surgery,
yeah.
you're
I
gonna
understand now what
eventually
it's saying. Yeah, yeah. Sorry, I was a bit
Yes.
confused by that too.
Sorry, I should have
That's
explained
okay.
that. But yeah, and I think they eventually did it because like I had a nap and I woke up and he was gone.
Well, they would have had to.
Yeah,
he was
I
going to
think-
die.
Yeah,
if he didn't do
yeah.
it. Like
Yeah.
septicemia would have kicked in.
Exactly.
He would have been fucked.
Yeah,
Hopefully
so
God forgives him.
I would have. They have to go in rectally to do that procedure. I thought they would have cut you.
yeah, so I think they probably need to go in through there though to take all the crap out because it backs up, right? Like it's pretty.
I've had a colonoscopy.
Have you?
Yeah.
Well, if I remember correctly, you volunteered to have one. You didn't
No,
actually
no.
need to.
It was elective. Like
It was
all by
elective,
choice.
yeah. It was actually the first. They said it was the first
like that.
cosmetic colonoscopy they've ever had.
Without being under.
Yeah, without being under. either.
No, I had a parasite that nearly
Nice.
that nearly killed me.
Really?
Yeah, from Thailand.
Oh, did you tell me about this?
Maybe, yeah. I've told a few people about it, yeah. I went to Thailand for schoolies, and it's a parasite called Blastocystis hominis. And it only affects... Some people live with it.
Those
and-
damn lady boys.
Yeah. No, do you want to know how you get it? If someone like has shit on their hands and touches your food, like if they put shit in
So-
the food. So I would have eaten someone's poo. That's how you get it.
Wow. What was
Gave
the,
a lady boy a head job after she bummed you. Don't cut that out.
What's the symptoms? What were you feeling?
Frequent vomiting, loss of appetite, nausea constantly. I started shitting blood after a few
fucked.
months. Like
Honestly, parasites sound
They thought I
fucked.
had bowel cancer because they couldn't figure out what it was.
Yeah.
And then like a tropical disease expert, long story short, ended up going, I know what this is. They got so when they do, because they do a stool sample to check for parasites. This parasite isn't tested for because it's so rare. So they never check for it. You have to you have to send it to like a special type of lavity. Douglas Hanley Moore pathology clinic, and then they'll specifically test for it, and they test it, and it came back positive. But even if it comes back positive, only a certain percentage of the population get affected. Some people can live with the parasite, but it was essentially eating at my stomach lining.
Right.
Yeah, so gastric acid was flowing. And it was fucked. I was dying. But anyway, so what they do is they did a surgery where the elective colonoscopy up my bum, and then they have a camera there to try and spot where the swelling is.
Oh, right.
And then they'll do antibiotic injections through your stomach onto the stomach lining.
crazy.
Yeah, and they'll kill directly the parasite with these antibiotic injections. Yeah.
Crazy, hey.
And I was
that's
shitting
stuff
yellow
is
for
crazy.
like a week.
My wife got nothing to that extent, but she ended up getting a parasite in Thailand.
Like a tapeworm or something.
No, it was something that was causing bleeding.
Yeah.
Like when she'd go to the bathroom, but like it's crazy the parasites you can get.
Yeah.
So
Yeah,
I was
just
shitting
be-
myself
be
when I went to
careful.
Bali.
Yeah, Bali belly.
I tell you something because I got an upset stomach in Bali, but I got to credit you. I reckon the colostrum tablets.
Oh, did you
got
take
me-
'em?
I was taking them every day.
Yeah.
I reckon I did get. I think a slight bit of fucking like gastro over there.
Colostrum?
Colostrum tablets.
As in
Like the
as
breast
in-
milk?
As in breast milk?
Yeah, but from a cow.
Bovine colostrum.
Yeah, bovine.
Yeah.
Good
So
for you. This is always good for you.
What are they called? Travel.
Travelan.
Travelan.
Yes, I've been telling
Bro,
everyone
I was taking
about
them
it.
every
Next-
day. I reckon that like
Probably.
reduced the symptoms that I had.
Were you guys eating the same stuff?
We're eating the same stuff.
Yeah.
But
So
you
that
didn't
probably
get it.
saved you.
And like to this story of like, I don't think you get stomach issues. Like I've had gastro issues.
Ever since I got rid of that parasite,
This
I've
is
been so solid with
Well,
my
this is
stomach.
the thing with my wife. She doesn't get stomach issues, man.
Yeah.
Like ever. And I reckon
Maybe there's something to having
having a parasite.
Bro, like because everyone around me will start vomiting, getting gastro, and I never get it.
I've had some fucked up gastro.
Yeah.
Like my wife and my daughter get it, and I'm fine. Like it's so weird.
I
Yeah.
had 7 days of gastro. Oh my God, I felt like I was fucking dying. I remember on the 6th day, I was talking to the nurse on the phone. I'm like, I think I got to come in. Like, I've lost like 5-6 kilos. And she's like, look, if it persists tomorrow, come in.
Yeah.
Like, we're
Yeah.
going to have to stick you on an IV.
And did it get? Did it
And
go
the
in?
next day, everything stopped. And I was like, thank Christ. Like,
Fuck, that'd be horrendous.
it was fucked.
I got salmonella once, and that
That's
was like that. It was like 2 weeks of just constant vomit.
Remember how we were eating sushi with Bruno at that staff thing? And you're eating tuna and the next day you were like booting?
Yeah, because I'm allergic to tuna.
You're allergic to tuna.
But he wanted to eat it because
But I didn't know it was tuna.
Really?
No, I swear to God, because it looked like this raw.
Oh, sashimi, tuna sashimi.
Yeah, it was
The
tuna
red-
He
sashimi.
just wanted to take full credit
No, I
of the
didn't-
free food that he had there.
Like, he saw free sushi. He ate. He just
Yeah,
ate.
he was like, "Fuck it,
I remember
so I'm
that.
gonna run the."
I remember
gamut."
because you were saying like I'm allergic to tuna. Do you reckon I'll be okay? And everyone was like, I don't know.
Yeah, I remember
Yeah.
this conversation. I don't think you remember, and you were just like, "Fuck it, I'm gonna take the risk," and you were
Okay.
vomiting the next
Fuck,
day.
it
Yeah,
looks good,
I
it
was
looks good.
fucked the next day. Like I was proper sick. Like
I had to
there
cut
was,
out of class.
yeah, it was cooked.
That's very specific though. Like,
It is weird. It's
are you
weird.
allergic to other fish?
No, just tuna, and I'm also allergic to penicillin.
Oh yeah, same.
Yeah, a lot of people are.
A lot of people are. Yeah.
So
Yeah.
I have one more question on physio.
Yes.
Because we talked about this actually a couple maybe months ago when you were treating me for some.
Oh, I know he's gonna talk about.
What?
Are you gonna talk about us with massaging?
No, but
RMS?
actually, thank you for reminding me. We'll
Yeah,
talk about
please bring
later.
this up.
We'll talk about this later.
Please bring this up.
But we're talking about like how different peoples have like sort of different.
You're talking the mic, Nick?
Different physical qualities. Like you were telling me that a lot of the Polynesian guys that you treat have really stiff ligaments, and whereas a lot of the Asian guys you treat have very loose ligaments or very
Yeah, so-
mobile ligaments.
I would actually say probably Polynesians usually actually don't have stiff ligaments. They're usually more
I
like
didn't say that. I just mean, like,
hypermobile. Yeah, I know. You're just.
I just
We
don't
can-
remember.
There's
We're on
actually
the
more
same
like Europeans, like kind of like a Celtic Anglo background.
Yeah.
They're always the ones that are super stiff.
Right.
Like super stiff ligaments. Yeah, like usually.
I'm just saying.
So like for example, all the
Irish.
yeah, like as a stat, like all the Muay Thai guys that come in that have hip issues, like impingement and labral issues, 90% of the time they're English and Irish dudes.
Interesting.
Yeah, like I've only ever seen one Asian guy for a hip problem.
Interesting.
Yeah.
Wow.
And so I reckon that's probably like genetics plus, always being in an Asian squad all the time.
Yeah.
So like environment and
So what are the differences in injuries then? So if you're more mobile, like most of your Asian clients that you said are, they're getting injuries coming from over mobility.
yeah,
and
from
laxness.
hypermobility.
Whereas the people who are stiffer, they're getting cracks.
yeah,
and breaks.
Yeah, so they're more likely to actually kind of like tear something.
Yeah.
And they're usually going to be more prone to impingements and things like that with their really poor lack of hip range of movement. So
Okay. I see.
yeah, and so like generally like in jiu-jitsu I'll see like those two different types, the really floppy like hypermobile people and then the really stiff people as well. And so it's probably beneficial to be a little bit more hypermobile in this sport. Would you guys agree?
Yeah.
And then but
Without going too far.
without going too far, but then having the strength
Yeah.
to control all of that mobility.
So really just intervening if you're super mobile with strength training.
Lots of strength
And if you're super stiff,
More
focusing
mobility work.
On mobility.
Yeah.
To get to that more of a mid-range.
Exactly.
Because
yeah.
I think a lot of people want to be on an extreme in terms of physical qualities. They want to be super strong or super explosive, but obviously that comes with extra stiffness. Or if you're hyper flexible and you can put your legs in weird positions, that comes with a little probably not strong enough, not stiff enough through your joints. So you do actually want to be in that mid range. Funnily enough,
Yeah,
you don't
so-
want to be hype or anything.
Exactly. So a lot of people don't realize like you need to be able to generate joint stiffness to produce power and strength. Like if you're just so floppy, you'd be like an octopus. Like you'd just be so or like jelly really. There's literally no structure there. So you can't generate force through the ground and then through your limbs. Whereas you need that stiff joint structure to be able to transfer the force. But in jiu-jitsu, that's what's weird about jits. Like you need that mobility as well. So you need to have that kind of middle point. So,
Everything has to be tailored to the sport that you're doing.
exactly.
Right?
And then your style of game too,
course.
as well. So,
I found that really interesting because there's so much thought and discussion goes into what physical attributes are important for grapplers, and it's such a diverse sport because if you're not flexible, okay, you can pass.
Yes.
You're going to play on top. And if you are flexible but you're not strong or you're not stiff, maybe you're not going to be a wrestler, but you have a good guard. So that, yeah, it's a
But I think like in jiu-jitsu, right, you can play to your strengths. Like if you're less hypermobile, you will see people more lead towards like a wrestle up sort of game.
yeah.
Right? Half guard, things of this nature. Would that not make sense?
It does make sense. And the thing, I also think if your jiu-jitsu is good, it shouldn't. The better your jiu-jitsu is, the less you're relying on physical qualities, obviously,
Yes.
because physical qualities are just a form of athleticism. And what does everyone who's good at jiu-jitsu as well? The more athletic you are, the less technical you have to be. So even though I say, what I said about the physical qualities, you want to be able to do everything without relying on physical qualities. So then what is like the ideal physical state to be in for jiu-jitsu? It's that mid-range, right? Where you're not hypermobile or too stiff. You're in a mid-range.
Yeah, and being adaptable as well. Like what we tend to see like is some joints specifically, you probably want to be more hypermobile, like your hips.
Hips
like,
or ankles?
Ankles too, yeah. Ankles, hips specifically. It's a tricky one with knees. Because like if you're really hypermobile in your knees, so like if you sustain a ACL tear, you're now technically hypermobile because now that ACL is no longer holding you there.
I was already hypermobile in my knees, and now I'm just extra hypermobile.
Depending on your game, that might be beneficial. Like if you like to play certain types of guard, then that might be beneficial for you. But if you're, say, like a wrestler, top control, explosive kind of person passing, then it'd probably be better if you were able to generate a little bit of stiffness. Now, you can create that stiffness to a certain extent with your musculoskeletal system, like just muscle contractions. But there are some positions where you can't contract the muscle to create stiffness.
I'll let Matt in.
Yeah.
So like figure 4 positions.
Yeah.
Like when you get your leg up in that figure 4, there's no muscle that exists.
So you're relying on ligaments at that point.
So certain positions, it's all.
Well, this is where I had my LCL tear, is because I was locking into a calf slice, and before I could brace my leg, I had the training partner kick their leg back, and my foot accelerated to my chest.
Yes.
And then my LCL ruptured.
Yeah.
Going on to that, because we talk about Tom Cross's bracing protocol. Before I even heard that, I was braced for my LCL. Was I with you at that time?
No, I think that was with Tom.
It would have been with
That was
Tom.
before I started.
I think Matty McFadden.
Yeah, and Tom
I think
and
it
Matt.
was with Matt
Yeah.
as well.
And
And I remember them bracing me. What's up, bro? You good?
Hey. That's
I
like,
remember them bracing me
yeah.
to avoid surgery.
Yes. And so with the collateral ligaments, so
Yeah.
MCL is included in this.
Yeah.
They do have the potential to heal on their own with no surgery, especially because they're extracapsular.
Yeah.
Like that, so they sit on the outside.
outsides.
Yeah, and so if you immobilize it in a shortened position, the ends can come back together.
Fibers reattach.
Yeah, and so like for example, like whenever we get patients coming in that have like just shredded their knee, they've done MCL, ACL, all that kind of stuff. Before a surgeon would even touch their ACL and their meniscus and whatever, they want to let the MCL heal.
Yeah.
So they'll brace them, let the MCL heal on its own, and then they'll go in after, and then they'll do the ACL and whatever else that needs to be done.
Is there a time limit with surgery? If you do a knee, is that
Right.
and you just leave it and you say, I don't know if I want to do surgery, maybe I got to let the MCL heal, whatever it is. Is there like a certain time that if you don't get in there and fix the knee, it's going to prevent you getting in there?
It depends. Yeah, it depends on what the issue is, like what the structure is. Like let's say if it's let's say if you wanted to say you changed your mind and you wanted to do an ACL reco, Chris, you could do that literally whenever.
No, I know.
Because
I know, I
the
remember
graft,
us
they can
talking
always
about
take the
this.
graft from somewhere.
But his ACL is now connected to his PCL, no?
Well, yeah, that's a good question. So what's left of the ACL is connected to the PCL, but usually what the surgeon would do is clean that up. So they would like if that stump is there and it's like in the way,
They'll take it out.
yeah, and if it gets in the way of where they drill through, then they can always just remove it. Yeah, and they'll be able to take a ACL.
I remember us
up,
talking
so
about this
hamstring.
because that was the reason why I was like, well, let's just go the route that we talked about because later on, if I ever changed my mind or I had issues, we could always go back.
But there
down
are
that route.
there are other ligaments that's not the case with.
There were other types of tissues.
Yeah.
So like say, and this is probably less relevant to the knee, but like let's say if you like, we had a guy that ruptured his bicep
Tendon.
off the bone and it retracted.
Yeah.
Like
Yuck.
you
have a time with this. The same with
Yeah.
hamstrings, right?
Oh yes.
Hamstrings, because we talked about this with
Yeah.
Cam.
Yeah.
Why you have to get in there straight away?
Yeah. So
'Cause it shortens.
yeah. So like with that hamstring, so imagine muscles are like rubber bands.
Yeah.
If you completely sever one attachment, it's gonna
Yeah.
retract back. And you know, for a hamstring, like you know, with Tam, for instance, he had. I hope he doesn't mind me saying this, but like, it was a pretty proper tear. Like
No, he did, yeah.
he needed to get it operated on.
Yeah,
Otherwise,
yeah.
it would have.
I remember when he did.
massive
Pec tendons would be the
dysfunction.
same, right?
Pec's the same. Yeah,
right?
yeah.
Because I know
so-
someone right now that's dealing with a pec tendon issue.
Yeah.
And it's like, there's definitely a divot. And he's chucking up whether he should have surgery.
How long ago did it happen?
I don't know. I think maybe weeks or maybe.
Yeah, because ideally you want within like 2 weeks.
Oh.
Because
I
the
think
longer,
it's definitely outside of that window now.
because what happens is your immune system,
Right.
because your immune system will come in and it'll start to gobble up the ends of the tendon. Yeah.
Fuck.
Sorry, I got a bit hungry.
Remember how we had this discussion of being stuck on an island with this guy? Definitely not.
Yeah. And so it degrades the quality of the tendon. So like the earlier you do it, the better. And then
course.
muscle wastage and all that other stuff
Exactly.
with your friend. So he should probably like,
Oh, well, I had
Get
this
onto it.
discussion with him. But I think he's speaking to a physio. I think he had an MRI on it. I don't know where he's
Yeah.
heading, but he was having conflicting things whether he should do it or not and whether it was going to affect him long term.
how old is he?
I think he's in his 40s.
Does he work a manual job?
No, I don't think he does a manual job, but I think he likes to train. He likes
Yeah.
to do jiu-jitsu. He likes to do rings, muscle ups, things of this nature.
It's going to be
It's 100%
really
gonna
hard.
affect him.
You use your pecs so much for calisthenics.
Exactly.
Like,
Well, that's what I think, to a degree, that's
Yeah.
extent of what he loves to do.
yeah.
So, yeah.
Because you can function without a pec. Like, it's not going to make you, you can do all your day-to-day stuff most probably without a pec, but you'll lose a lot of power. So sports and manual jobs are going to be really
I remember
hard.
this. I remember I was at one of the Mendes brothers seminars and I had a friend that was training with Hafa in the sparring rounds at the end of the seminar. And he got put in an arm lock, like a spider web. And Hafa had a kimura on his arm and was just pulling his elbow to his chest, trying to separate his hands because this guy was a bodybuilder. So he's just clenching his hands together. And I remember he finished the round, got his arm barred, came out and he said, bro, can you come and help me for a second? Took his rash off and he had done his pec tendon.
But that's
You
what you
could
get
see
being a
the divot.
bodybuilder because he would have completely deteriorated the
Again,
health of his tendon by
But-
taking gear, right?
Yeah, so that's one of the things that
I don't
you
know
gotta
if
think
he was a
about.
gear, if he was a natty or not, but
But
I'm
like,
not too sure.
okay, so like, if tell me if I'm wrong, but especially bodybuilders are taking gear, they're getting super muscularly strong. It wouldn't have been Huffer pulling the arm out. It would have been him pulling that arm back,
no,
and then
again,
his
like-
his pec tendon not being as strong enough to keep up with his actual pec.
Again, I don't know if he was gearing or not, if he was a natural athlete or not.
Let's assume he was gearing. True.
But yeah, like that's always something we got to think about in the back of our heads. Like if we get someone and it's always typical. Like there's always like a 50-something-year-old guy that's just like saying started going back to the gym. They may or may not be on gear, but what the influence of the gear does for the tendon health is like what Nick said. It can make your muscle belly grow disproportionately large compared to the tendon.
Yeah, we talked about this when I was doing
And
the
then you
test.
get this imbalance,
Yeah.
and then that can weaken the tendon relative to the belly.
Would that do that with ligaments too?
No.
No, it has no
Because
factor to
tendons are
ligaments.
muscle.
So you don't
connected.
think me being on test would have affected my ACL tear?
The healing.
No, as in
It can
physically
weaken.
tearing. Do you think it weakened? There's
No,
a chance.
I don't. To be honest, I don't think so.
Okay.
Tendon more so because
Okay.
of the contractile element.
Is that so? The muscle gets so strong that it pulls too hard on the tendon, which hasn't had enough time to.
Yeah, because
mature
tendons
with
don't
the
adapt
muscle.
the
But
same
this
way
would
that
naturally
muscles do.
happen as well with bodybuilders that are just packing on size, right?
Yeah.
It could even just happen without steroid.
Yeah,
or,
it can happen, especially the older you get.
Yeah.
So like you're not gonna get a tendon rupturing if it's in really good health, unless there's trauma or something like.
I get what you're saying, but
external
I'm just saying
force.
you're talking about the belly of the muscle.
Yeah.
Comparison to
the tendon attachment.
tendon
Yeah.
attachment, right? So if the belly of the muscle is much larger,
And specifically if it's grown larger in such a short period of time.
right? But
which
you would
would
naturally
be-
see that anyway, even with let's say natty athletes that are bodybuilders, right? Because there are natty.
I don't think you would
athletes.
though,
Why?
because you don't have the ability to put on as much.
No, I
strength
get what
and
you're saying,
size.
but you would still see accelerated growth more so than an athlete that isn't targeting that sort of sport
So you
specific.
mean, like if you're going through if you're just looking at
Yeah,
hypertrophy
hypertrophy
training.
training.
I don't. Do you agree with Chris?
Age does play a role. So like
Yep.
we get older guys that have had like a massive gym history and training history, like in their 50s, 60s, and they get ruptures and they insist that they haven't taken stuff. So like I believe them. So like you do get it with and without the history of
But
gear.
it's certainly more prevalent.
But it is more prevalent
because there's a
with
faster
gear.
growth rate, right? But I'm just saying, like in that sort of sport, we're talking about accelerating the growth rate of the belly of the muscle,
Yes.
right? So it could even happen inside of natty athletes. That's what I was
The other
asking.
thing that you've spoken to me about before, I don't know if I'm going to tell it right. When you're on gear,
In the mic.
the effect that this has on non-contractive tissue, such as ligaments and tendons, is that when they heal, they can heal a little bit more. The fibers proliferate in a crisscross more, and they because you're on anabolic agents, your body lays down fiber so quickly in this pattern that it's harder for your body to then put it back into a stronger pattern.
Yeah, for tendon, not for ligaments though. Yeah, so like when you're on the gear, right? Because of the anabolic response, my understanding is you're actually going to get you almost like give yourself a tendinopathy. Like if you look at the tendon under a microscope, you're going to get all this injection of different cells that shouldn't be there. So like you get edema in the tendon, you'll get a laying down of all these collagen fibers in disarray. And so that's even kind of like irrespective of the overload that we were talking about, like growing the muscle belly disproportionately compared to the tendon. Like the actual cellular like quality of the tendon actually starts to come down as well with extended.
Would this happen with
use.
peptides?
So this is where we're not sure. Like
Yeah.
I don't like because we don't know, we don't have that long-term
Long-term
research on it.
yeah.
So
Because if something like BPC, which it's not an anabolic agent, it promotes blood flow, which can help get the growth factor to the area quicker. What are the chances that it actually overdoes it and causes your body to lay down so much tissue that it starts to decrease the quality? It doesn't. It seems like it
Do
would
they
be pretty
work
good.
at that same rate?
yeah,
I don't,
so
do they? Because they're not anabolic,
So in that rat study, so the BPC, one of the main studies for it was a rat model study where I believe they like severed on purpose rat tendons. Yeah, and then administered peptides, BPC, and then checked the comparison between the groups that didn't have it as well. And even the quality of the tissue was improved.
Yeah.
So it's not just that it healed faster with all this random scar tissue. The quality of the healed tissue was on par with the
Interesting.
pre-injury tissue.
Wow.
So,
From
like
those short-term studies,
Yeah.
it looks like you don't have the same sort of issues as
They should do
would
human
with
studies of
anabolics.
it. Do you know
Yeah.
if they are doing it?
So
We're conducting them at the gym extensively.
and it's not randomized though. That's the only thing.
Like
But
you must have so many mini studies in your head from all of us, like doing.
you know what you guys should do? You guys should literally just have random vials of BPC, and then not all of them are BPC. Some
Yeah,
of them are just
placebo.
saline.
Yeah, placebo.
And then just give them out to to
I
the
don't
members, and then that way you
know
can
if we're
track it.
legally allowed to do that.
Because that's how you can randomize it. But then anyway, so that's the thing. Like I don't doubt that something like BPC would help a lot. It's just that where does it go? Like what's the long term kind of ramifications of increasing tissue growth anabolically in the long
Cancer.
term? So yeah, who knows? Yeah,
Yeah, I mean, I think peptides are very, very promising. They're probably, in my opinion, the future of combat, like of sports medicine.
Yeah, because it's like what's interesting to see is like when you've got those really hard anabolics, you know, they have such a big, significant effect size. Like it will impact you a lot. So then the consequences, like the side effects, are going to be almost like equally as large.
Yeah.
Whereas with what it seems like with some peptides is the effect it has on you is a little bit more smaller.
Modest.
So maybe the effect, the side effects are more modest as well.
Yeah.
So
Which it's good.
In theory.
Yeah.
in theory.
In theory.
Yeah, but
They don't know yet.
We don't know. People might start growing a third head after having used
I
BPC.
think that's a bit of an extreme thing, but yeah, just with cancer and things like this, that'll be an interesting thing to see where it is in 20 years, or if there's even more improvements on them. But as compounds, where they go with the compounds now.
All right. Well, thanks for coming, Kevin.
no, it's all good.
We didn't even touch on conspiracy theories.
Like,
That's what he wanted it to be about.
oh, did ya? Did you want it to be about
No,
conspiracy?
it just happened. Like I've been getting so many moon landing videos in my YouTube.
But okay, let's think about those algorithms because you're constantly looking at certain things.
Yeah.
You're probably getting fed other things now.
Oh yeah, 100%.
The amount of shit I've sent you
Yeah.
probably has encouraged this algorithm
Yes.
for sure.
Yeah.
But I definitely I got to one point with you that all it was about was microplastics.
Yeah.
I was like, I don't
And he
even
was
want to
forwarding
respond.
them to me, bro. I was like, I'm already
Yeah.
getting these from Chris.
I was like, no, I never sent you anything
yeah,
about
you did.
microplastics.
Yeah, a few like Instagram reels and shit like that.
But like, I've never been a big thing. Like, I've understand those sorts of environmental impacts,
Yes.
but it's not even like I would be more so about fluoride than it would be like microplastics with me. I don't know why you went down this tangent with microplastics.
You've cut them out now, haven't you?
No, I've just stopped sending it to you guys.
Yeah,
As in you've cut out microplastics from your life?
Like we're getting some now.
Yeah.
Yeah.
Like in the coffee cups and whatnot.
Yeah.
But like,
You got to cut out macroplastics first before you can cut out What are you laughing at?
guy.
You do.
But anyway,
yeah. So I've made the changes now. So like we even have a water filter at the SportsLab, the new place. No, but it was already inbuilt
what's that?
when we moved in there. Like
Oh,
it wasn't
right,
because
right,
of
right. I wasn't
me
going to say
and
anything
Juno
about you, but yeah, you and Juno
petitioning Tom.
Yeah.
To
How's
get
he
a-
going?
Who's
Juno.
that? Juno. Yeah, he's good. He's good. I've sent him down many rabbit holes.
I know, but
Is he
I think
the
to
guy
the,
that wears only cotton or something like that? Like,
but I think
Yeah,
to the
yeah.
point where you've actually made him a
Like
little bit too worried.
Look, it started off as a troll. Like honestly, like I just like a healthy bit
I
of
don't think it
paranoia.
was a troll.
I think is.
you were adamant that these
But he
Things
took
were
the bait
impacting you.
and he went
deep.
yeah.
Like he even went and bought these expensive organic undies.
Yeah, we were talking
organic
about it,
cotton
yeah.
undies.
I've been wearing them. Bamboo silk.
No one can hear you, Nick, anyways.
Bamboo silk undies.
Anyway.
Are those the ones I found in the dryer yesterday?
No, I think those ones are.
What was the deal, Chris, that if you washed his undies here again, there was something, there was some sort of
Oh, that
condition.
you'll cut off from the laundry.
No, that wasn't the deal. First of
Yeah,
all,
it was.
I think it was part of it.
Yeah.
That wasn't the deal. First,
He doesn't want it to be part
Yeah.
of the deal because he wants to continue to keep doing his laundry.
I'm not washing my undies.
How, again,
Well, your
we're
undies were in the
deferring
wash.
away from conspiracies, talking about this dude.
This is a conspiracy.
Underwear.
Once a
Why do you
week,
wear tiny
maybe.
whinies? Why don't you wear like,
What do you call them? Tiny whinies.
Yeah,
they're not tight. But say that clearly. Not tighty whities.
I didn't say that. I said tiny whinies.
Tiny whinies.
That's what I said.
Yeah, they're red. They're red.
Yeah, that's what he did say.
I don't wear tidy whities. I wear underwear. Bamboo. Actually, this I think is bamboo silk underwear.
Why do you wear budgie smugglers?
I don't wear budgie smugglers.
Well, they were budgie smugglers. Were they not budgie smugglers? The ones I put into the thing?
I briefly saw the chat group when I was it this morning or last night? It was last
Yeah.
night.
I don't. I wear boxer
It was-
briefs.
it
I wear
was yesterday morning,
I wear
but-
brief style of undies. These ones are slightly higher cut up the thigh, which is nice. Sometimes. It is.
How's Ginu going anyway?
He's going well.
Is he better now?
No,
Has he
he's better.
settled down a bit?
He's less paranoid now.
Okay,
so it's
cool.
good. Yeah. Actually, that's a great business
There's-
idea, though.
There's
Like-
there's already businesses that are doing it.
really like
100%
for
cool.
Rashis.
Not for Rashies, but
Yeah,
I
there
don't
is
think-
one. There is one
for Rashies.
Yeah, but the
Really?
problem with that is that it's
If
like
it tears,
they're
it will
gonna.
tear.
I don't-
they're
yeah, I
gonna
don't think
stretch.
there's
And if you
the elastic.
you wash them so much that it's just gonna end
deteriorate the
But
material.
the point is like if you have a semi-cotton, some synthetic rashi, is that good enough, or you're still
Yeah.
getting the microplastics through it? The only real way to go is to train naked. That's the most natural way
It is. Yeah.
to train, as they used to do in ancient Greece. A bit of maybe
like
This
that,
is what Nick wants.
Turkish oil
a
recipe.
bit of oil, maybe. Yeah.
We should go try that one day.
Yeah. What do you mean?
I know Nick would love that.
Nick wants to go in that direction for certain reasons.
For certain reasons.
Yeah. We all know the reason.
Let's wrap it up.
Thanks,
Anyone
Kev.
you want to shout out?
Just want to shout out actually you guys for looking after my son. So
Oh,
very
thank you.
much
Well, thank you
appreciated.
for looking after our health.
Shout out Levi.
Shout out Levi, bro. Yeah.
Beast.
Shannon Connor too. Get back to training,
Yes,
mate. We
Shannon
miss you.
Connor.
Are you going to say he's what?
Yeah, so thanks for taking care of Levi
of
because
course.
he loves coming here, hey, to train.
great.
That's great.
Yeah. He doesn't
yeah.
get cranky now after his nap coming in, so that's great.
No, he doesn't. He doesn't.
He's got this
actually,
cute
yeah.
little smile when
Yeah.
he wakes up. He'll
Yeah,
see you
he's
like,
a
"Hey,
cute
Levi," and he'll be like,
Yeah.
he'll smile at you.
And he's always excited to show me something like Pokemon or something like that. You know?
No, is he?
Yeah.
Yeah.
Tell everyone where you work at.
So I work at SportsLab Alexandria. So that's 530 Botany Road. It's actually in Beaconsfield since
Okay,
we moved now.
yeah.
But we still keep the name.
Yeah,
Alexandria.
yeah. So if anyone needs jiu-jitsu, combat sports physio, hit up Kevin.
Cheers.
Highly
You got Instagram? What's
recommended.
your Instagram?
Kevlay Physio.
Okay, cool. Sweet.
That's his surname, just so you know.
Kevin Wilson Lay. All right. Thank
I
you,
know why.
everybody.
Cheers. Thank you.
See ya.
Yeah.
You hit the...